Good evening, ladies and gentlemen. The October 3rd, 2022 Board of Health is called to order. Please silence all electronic devices. At this time, I would like to welcome our health officer and many folks from the health department staff, but led by Dr. Nilesh Kalyanaraman. You may have the floor.
Thank you very much, Chairwoman. Um, I'm Nilesh Kalyanaraman, the health officer for the Anne Arundel County Department of Health. I want to thank the Chairwoman and the members of the County Council for having us here today for the Board of Health. And with me are the leadership of Mental Health Agency, Adrian Michler, Deputy Health Officer Tony Gadden, and I'm going to go through all of them. I can't see them behind me, but the directors of the Department of Health. 1 second, let me turn this on. Shared with you a large packet, and like I usually do, I will not go through all the slides with you today. That is to make sure that you just have that information. I'll go through a subset of those slides to give you some highlights and some of the important initiatives that we have in the health department. As usual, I like to start with our vision, which is a vibrant Anne Arundel County with healthy people and healthy communities. And our mission is to preserve, promote, and protect the health of all people who live, work, and play in Anne Arundel County. I mentioned Adrian Michler, our Executive Director of the Mental Health Agency, and Pam Brown is the Executive Director of the Partnership for Children, Youth, and Families, is a key partner as well. And with me, I have other key staff at the Health Department, Megan Pringle, our Director of Communications, Sandy O'Neill, our Director of Behavioral Health Services, Jen Schneider, our Director of Disease Prevention and Management, Don Curdian, our Director of Environmental Health, Tom McCarty, our Acting Director of Family Health Services, Karen Siska Creel, our Director of School Health Services, and Marilyn Bobbitt, who's our Acting Director of Finance, couldn't be with us here today. I want to highlight them and our entire staff. We've talked about the challenge that COVID has been, but also, aside from COVID, the range of work that we do that's reflected in the materials that I've shared with you today, they make it possible every single day. Our budget has grown over the course of the past few years to $86 million, and we have approximately 819 employees at this time. And I want to dive right into a topic that's kind of been top of the mind lately, monkeypox. We have been leading off these conversations with COVID for over 2 years now. But I think that what we've seen is that there are new and emerging infectious disease threats here in Maryland and Anne Arundel County, but these are going on worldwide. So with monkeypox, it is an illness that's similar to smallpox. It starts with flu-like symptoms, and then after about 5 to 12 days, so typically about 1 to 2 weeks, you'll see the appearance of fever, rashes, or sores, and those sores are very typical to monkeypox. They go through stages including scabbing and having a central lesion before they heal. So they kind of look like pimples or blisters at times, and you do see other symptoms like body aches or headaches as well. One of the key things is that you can also see swollen lymph nodes with monkeypox. The reason we care about this is that for over 60 years, it's been endemic to portions of West and Central Africa. And we have seen cases as recently as last year of monkeypox in Maryland, but those are travel associated. And what happened earlier this year was that monkeypox started to spread in regions of the world where they have never spread before, including in our county. And what we're seeing is that it spreads through direct person-to-person contact. So skin-to-skin contact, sexual or intimate contact, or having close proximity to others, such as living in a house or sharing a bed with someone, sharing towels, or prolonged face-to-face interactions. And what we've found is that the people who are being most affected are those who are cisgender, transgender, or gay, bisexual men who have sex with men. We also saw that transgender women or non-binary persons assigned male at birth who have sex with men are also being affected. And then there's other opportunities for transmission, particularly those who have multiple or unknown sexual partners. And I bring this up because those are the groups that are being most affected, but they're not the only ones who have been affected. And so we've seen a range of cases. Our first case in the U.S. was in May 17th, and we had our first case in Anne Arundel County just about 3 months ago. We've had about 35 cases in the county, and what we've seen is that over 90% are male. 49% are Black, 23% are in white individuals, and 20% in Hispanic individuals. So it's predominantly affecting males, and it has a high predilection in amongst Blacks, much higher than our population. And so a lot of our work is really focused on what we talked about: contact tracing, testing, and then as vaccines became available, vaccination as well. And so our epidemiology teams were leading these efforts, doing the contact tracing that you know about, interviewing contacts, figuring out who needs testing, and working with the state health department and the CDC. Key to that is our vaccination program. One of the really just kind of neat things is that because of all the work that we have done with COVID, we were able to really quickly stand up our vaccination efforts. Essentially, we just slotted them in as we got vaccines, and we didn't get a lot initially, but as we got them, we were able to quickly just convert some of our COVID appointments into monkeypox vaccination appointments and get those out the door fast. In fact, we are being used as a referral source for others in the state to be able to vaccinate because we made access that easy. And so we'll see where this goes. In the past month, we've only seen 2 cases in the past 4 weeks, sorry. And so we're seeing both in the state and in the country that the rates of new transmission are going down with monkeypox. And so our goal is to continue to vaccinate, to continue to push that down. As we've always said with COVID, vaccination helps decrease the number of cases, but it's not a time to let your guard down. So now I do want to turn to COVID for just a few minutes to give you an update on where we are. This is a slide that I share, an update repeatedly. We've had to this point over 108,000 cases and over 1,100 deaths due to COVID. It's important to look at our hospitalizations. As we've talked about, the severity of the illness of COVID is what we care about, right? The hospitalizations, the deaths. And what we've seen is since that massive surge in January and February of hospitalizations, indeed the highest number of hospitalizations we had at any point during COVID, we've seen that come down significantly and have a pretty kind of steady number of hospitalizations. We're seeing typically about 20 to 30 people hospitalized at any given time between the 2 hospitals over the past 6 months or so. We've seen more variability, though, in our case rate. And so that suggests that to some degree that there's more stability in the number of people being hospitalized, while there may be more variation in the case rate. What we're really keyed in on is what happens this winter. And we've talked about this a lot, what does new normal look like? I think we're going to find out what new normal looks like, but we do anticipate increased spread like we do with other respiratory viruses when it is cold and flu season because of that dry, cold weather. And it's important to know why we continue to care about this. These are the leading causes of death. The blue bars are the leading causes of death in 2020. And we've included COVID for all of 2020, for 2021, and 2022, just to give you a sense of perspective as to what it's doing in terms of mortality. 2020 was the 3rd leading cause of death. We don't have final death statistics for 2021, so I can't share that with you at this time, but you do see that the deaths from COVID in 2021 were actually greater than in 2020, likely to remain in that as the 3rd leading cause of death. And then you see that the yellow bar in 2022, that's year to date through September 19th, and it's at 319 deaths. And so you're seeing a pretty consistent number of deaths. What's changed, obviously, is what our response has been from 2020 through 2021 to 2022 up to now. Our responses have changed, but we're seeing that it still has an impact on mortality and morbidity, and so we're learning more about long COVID. So it's really important to continue to protect ourselves. One of the things that we know is that vaccinations save lives. One of the things that we are really keyed in on is that these updated bivalent COVID boosters have increased protection against Omicron. And you can think of them in the way that we think of the seasonal flu vaccine. You get a new flu vaccine every year because it's updated for the circulating strains. That's what's happening here. But we're seeing many articles, and we're getting feedback that the general public is not aware that these are new or updated boosters. So we're going to be putting a lot of effort into awareness of that, and of course making it available as well. We do want everybody 6 months and older to get vaccinated. We see our vaccination rate in the 5 to 11 is still about 55, 57%. And in the 6 month to 4-year-olds, it's still less than 10%. Testing, of course, is a mainstay of our work. People should get tested if they have symptoms, regardless of their vaccination status, and we're continuing to distribute at-home tests. And we can continue to provide PCR testing in our facilities as long as that MDH continues to support that program. Masks, another key piece. We continue to distribute masks as well. Masks should be worn if you are in isolation or you've been exposed to somebody with COVID. And then we have prominently on our website our COVID community COVID levels, and that's the CDC system for identifying either low, medium, or high community levels of COVID that take into account both the transmission rate, but also the hospitalization rate, right? And gives you a sense of severity. So if you're seeing a lot of transmission, but people aren't getting hospitalized, that tells you that it's not as dangerous at this time. Certainly something to keep your eye on, but not as dangerous, versus if the hospitalizations start to go up. Right now, we are in that low category. And in the lower medium category, masking is optional, although folks can wear a mask at any time, especially if they're at high risk. And at that high level, we then would recommend universal masking in indoor settings because the severity would be high. So we will continue to post that on our website. That gets updated once a week, and it's an important way, particularly over the course of the winter, to be able to keep up to date on what is happening with COVID transmission levels. And then the last thing, which has actually been really important, is treatment, and easy treatment option, which is oral treatment for COVID. Particularly for those who are older or who have high-risk medical conditions, does decrease the risk of hospitalization and death and is easily available for folks. Moving on from COVID, I'd like to highlight our Community Health Ambassador Program. And this is something that came out of COVID and has proved really, really successful in terms of investing in our community partners to be able to do health education and outreach. It marries the expertise of the health department. We do have subject matter knowledge, along with the expertise of our community partners who are from and know their communities extremely well, more than we can know. And so by bringing us together with these community organizations, we can invest in them. They hire community health workers. They go out. They do the outreach, education, help with transportation. And they were instrumental to our COVID-19 vaccination programs, and we're expanding that now. Those community health ambassadors will also be doing mental health first aid training, and we'll be talking to residents of those communities to discuss mental health, address stigma, connect people to resources, and serve as a first point of contact. And so we're really excited about that. When we talk about mental health, when we talk about reducing barriers, this is another way to do that. And I just wanted to highlight one of the comments from Kingdom Care. Over the course of this last year, we believe we have been able to bridge the gap between health services and the community in a way that has created trust and strong relationships. The 8 community organizations that we invest in, to a person, have said very similar things to us, that this has been an amazing opportunity to build that trust and to bridge gaps. And so it's, to us, a key way moving forward. We're talking about COVID and mental health, but as time goes on, we look to expand that out into the range of topics that they will address. Moving on. Our Healthy Anne Arundel Coalition. This is our county-wide collaborative led by the Department of Health that includes community organizations, faith-based institutions, economic development, our federally qualified health centers, hospitals, and government agencies. And they're prioritizing, no surprise, mental health and also healthy eating and active living. We've talked a lot about mental health, and there's a reason that we are doing more to engage community organizations on this effort, because truly this is not a treatment issue, right? Treatment is one facet of it, but part of what we're trying to do with mental health is to create greater awareness, not just of how to get treatment, but wellness, how how to build resilience, and how to create different touch points in the community for when people do need help and how to be able to get that. So our mental wellness work group is working, and Adrian is a key leader on that, of course. Um, being able to promote the network of care, which is a way for people to identify resources in the community so that they can access treatment and care when they need it. So often when we're having conversations with folks, they're talking about the services they need in their community, and service providers say, but I do that. How come you don't know about that? And so what we're trying to do is bridge that gap. We're not trying to build something that isn't necessary. We're trying to make those connections where they are necessary. Next item I wanted to cover is our health equity and racial justice work. We've talked about this a little bit over our time here. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. And we talk about racial justice because when we look through our data and when we look through our health data, we see repeatedly that there are racial disparities in the work that we do. And so it's important to be able to call that out in the work that we do at the health department. I've shown you this as well. This shows you the one in green is the one that shows percentage of those with less than a high school education, and darker means a higher rate of those with the less than high school education. The middle one shows you the percent of population identifying as a racial or ethnic minority, and a darker color indicates a higher percentage of racial or ethnic minority. And then the last one in the purple blue shows you the median household income. And the darker the color, the higher the income. And what that all boils down to is what we see in our life expectancy. And we see that we have areas with a high life expectancy, those are in the dark blue, and then areas with lower life expectancy, those are in the palest of colors. And between our highest and lowest areas, we have a 15-year difference. And that's really the ultimate marker of how well we're doing. And that's what we're really keyed in on, is how do we close that gap by lifting those at the bottom up. And so one of the things we do, and I mentioned our community health ambassador work, that's one key element of this work. The other is our health equity and racial justice monthly community meetings. And it's really an important way to be able to communicate with those groups and communities that do experience these health disparities, to be able to understand what the impacts are of current health issues, programs, and services. And so just in the past few months, things we've discussed are youth engagement, our COVID vaccination rollout for the under 5 age, minority mental health awareness, monkeypox, back to school vaccinations, gun violence intervention. And it's been a critical tool, not just for us to get feedback, but also for community members to understand what's happening, to offer their perspectives, and for us to use that to refine the work that we do. Along that line, our gun violence intervention team continues to do their work. I want to highlight one particular piece of the work that they're doing, and that's looking at clusters of gun violence in Annapolis City. This slide has two different bar graphs. The one on the left shows you what's happening in Annapolis City only, and the dark blue bars are the ones that show contact shootings, which is the police term for non-fatal shootings, and then homicides, which are the paler blue. On the right-hand side is the total gun homicides in the county and the city. The paler color is Annapolis, the darker color is Anne Arundel County, exclusive of the city. And you can see that the number of homicides in the city are disproportionately high compared to the county. And so one of the things that we've been doing is working with Annapolis City on trying to understand what we can do to address that. And so in partnership with the mayor's office in the city, we engaged a group called Cure Violence Global. They've been around for over 20 years doing violence interruption. And violence interruption is a very specific type of program that looks to identify people who are at high risk of either being the victims of violence or perpetrators of violence, and to intervene with them at the neighborhood level one-on-one through peers who are trusted in that community. And those peers oftentimes do have a history of incarceration or being involved in the legal system or the justice system. And the key thing to note about these violence interruption programs is that when they're done with fidelity, they do show reductions in violence. They're not a cure. They reduce in studies, it varies from anywhere from 30 to 60% reduction. They're another facet of how we do this work, and it's what we talk about in public health, is that we layer multiple strategies on each other. This would be one strategy. Cure Violence came out, I think it's about a month ago now at this point, to talk with a wide range of community partners. So community organizations, individuals, service providers, mental health providers, social services providers, to understand what it looks like from their perspective, from each of these different perspectives, and provided us with an assessment that we just got back, I think about a week ago now, maybe two, and we're going to be sharing that with the participants in this assessment and then with the community in a few weeks as well. And we'll be sure to share that assessment with you as soon as it's ready for sharing. The goal with that is to take that and then use that along with the mayor, in partnership with the mayor's office, to actually look for funding and fund violence interruption programs in Annapolis City in the areas that are most affected, to reduce the violence in those communities and break that cycle. Another piece I wanted to highlight is our extreme risk protective orders. I believe you all are familiar with that. Anne Arundel County continues to lead the state in terms of filing these extreme risk protection orders, these ERPOs. And since late 2018, police have filed for almost 300 orders and recovered over 800 guns. Now these can be filed for, but the court has to approve them before they go into effect, and these only temporarily remove a firearm from somebody who's deemed to be a danger to themselves or another person. So it's an extremely effective way to temporarily reduce the harms, and that's a lot of what we talk about, right? Is reducing harms when there's the highest risk of violence either towards oneself or towards another person. And so we just put out a toolkit on how people can utilize these extreme risk protective orders. What are the steps they need to do to utilize them? So, because not many people know about this, it's mainly the police who know about this, and our police are great advocates, but we always want people to be able to have the tools to advocate for themselves as well. Moving along, I'm going to move to our behavioral health section and talk a little bit about our local behavioral health authority. There's a strong integration between the mental health side and the substance use disorder side here in the county. That's what we mean by behavioral health integration. And one of the visible manifestations of that is the annual plan that we produce jointly with the mental health agency. We've been doing them on an annual basis. The next one is going to be a 3 to 5 year plan, so that we can really look towards a longer range in terms of addressing our priorities. And there's 5 priorities that are in our LBHA annual plan. One is to focus on communication. Second is workforce development. Third is focusing on prevention, which is an area that we in the health department and with the mental health agency are uniquely situated to address, and is really what we are focused on. The fourth is to increase awareness of behavioral health services, and I mentioned a couple of the programs that we're doing around that. And then the fifth is to make sure that we're collecting, analyzing, and disseminating data so that we can understand what is happening in our county and what progress we're making, or if we're not, why we're not. One of those key areas is in suicide prevention, and we've seen between 2018 and 2020, we've seen a decrease in suicides. In 2018, there were 85 suicides. To 2020, there were 68. We don't have full data for 2021, and that's related to the data issues at the Maryland Department of Health. So we will, of course, share that once we have it. But I wanted to include just a listing of it's not a comprehensive listing, but it's a pretty long listing of the various things we're doing around suicide prevention, programs that we're supporting, and activities that are happening in the community. One of those items is the mental health task force that Adrian co-leads with the Anne Arundel County public school system that really is going deep on understanding what are the contributing factors to the increasing mental health needs amongst children, and then how are we coordinating services, to address that across all of the systems that are involved in caring for those children. And then I think once again critically, what are our proactive measures and best practices to get ahead of this as we go forward? So to that end, we talk a lot about the effects of COVID on the body. It's also had significant effects on our mental health as well. And we've seen that manifested as a 30% increase in requests for services through the crisis response system. That's a good and a bad. The bad is that there's a greater need. The good is that there's a system to actually address those needs. On the opioid overdose side, though, we have seen some progress, and we've seen a decrease by about 21% overdoses year to date in 2022 compared to 2021 at this time. And we're really glad to see that. You may have seen that there are news articles about the increase in overdoses across the country. We in Anne Arundel and in Maryland, frankly, have not seen that increase in the past year. We were flat starting out the year and have seen actually a decrease. So that's a really good sign that the range of programs that we're putting into place are able to help people, and we're going to continue to put more efforts into place, because even at the number of overdoses that we have, it's still a lot. We still have the third highest number of overdoses in the state. One thing to note is that anxiety and depression have increased since the beginning of the pandemic, but they are coming down. They're not back to their pre-pandemic levels, but they're certainly better than their peaks during the pandemic. One of the knockoffs effects of this is that the workforce has been significantly impacted by this. It's been a hard time for those in the healthcare space and the public health space, amongst other sectors, but it's been particularly hard, and we've seen that 20% of healthcare workers have left their jobs in the last 2 years. I can tell you that our agencies struggle, but then when we look around, all our healthcare partners say the exact same thing as us. And so we're all really dealing with the same problem here, which is how do you hire a workforce and retain a workforce that is tired, that is burned out, and that frankly has greater needs than just a few years ago. So we need more people, and we have fewer people. One item I do want to highlight is the new Suicide and Crisis Lifeline. This is the national 988 number. That number is active and working. There's still some tweaks that need to happen to it, but it is working. But we still have our warm line. That number, that if people know that number, they can still call it. We are still responding to that. But as time goes on, that 988 number, we will see more traffic on that, and we'll be getting more data on what the uptake has been like on that 988 number. Along that line of prevention, we're looking at mental well-being activities. October 2nd to 8th, so this week, is National Mental Illness Awareness Week, and we like to focus on the mental well-being activities so we can really focus on the positive pieces of that, right? Our goal isn't to just treat or stop mental illnesses, to promote mental well-being as well, build that sense of resilience. This is just one example of our work with the schools. I include this here just to give you a sense of the types of youth mental health programs we have. This is just a sampling of them. There are a number of different programs that are run not just by the Mental Health Agency, but also by our healthcare partners and our behavioral health partners in the community. Referrals come from all over the place, from the school system, from DSS, from private providers. Another key program we have, particularly in addressing opioids, is our hub and spoke system. our hub and spoke, we are the hub, the Department of Health, where when we're looking at opioid treatment, one of the greatest barriers for providers in the community to provide buprenorphine for opioid dependence is that it is challenging for them at times to manage the induction, so the starting of the medication, or when there are problems. But generally, what we hear from providers is we can handle it if it's stable. So the hub and spoke program works where we, as the hub, can initiate people into buprenorphine. So we can do that through our Road to Recovery, which is our main behavioral health clinic, or through our Wellmobile. And then once we do that, once that patient is stable, we can transfer them to their primary provider. If there's any problems, they can consult with us and/or transfer them back to us. If there's a change in status, we can manage it. And then once the stability, transfer back. Very much how, if you think about consultants or specialists work, that's exactly the kind of model that we're really talking about here. And we're seeing more and more practices join this. This is what's going to make buprenorphine more readily available for people, right? The entire purpose of buprenorphine is to lower the barriers of care for opioid dependence. It's a medication you can pick up at the pharmacy, and the more we can have it that your provider is just able to do it, it just becomes a piece of another visit. We now have 8 spokes, and we look to continue to add more of those spoke practices. And so I'm taking this opportunity to just kind of make a pitch to anybody out there. We would love to have you join our practice, our hub and spoke practice, so that we can continue to care for people who need this care. No discussion would be complete without talking about safe stations. Safe stations continues to be a key element of how we are addressing the opioid epidemic. We're continuing to see people coming in for treatment and services, and 70% of all individuals who were assessed were connected to substance use treatment, which is, I think, a really great sign of how effective that is in terms of being a low barrier way for people to access services. Another facet of that is harm reduction, in particular overdose response program. We're seeing that for folks who die from an overdose, only about 25% of them get Narcan. For people who survive an overdose, it's something like closer to 90% get Narcan. So Narcan is really effective at preventing death and giving people a chance at recovery. And so we're trying to continue to push people to get naloxone, get trained in it. And there's also efforts to get more organizations involved in that, so that they are providing that for their workers and for their clients. This is a key tool in terms of how we keep people alive so that they can get into recovery. I want to highlight our opioid intervention team for a moment. This is our countywide collaborative led by the Offices of Emergency Management and the Department of Health to coordinate our opioid activities throughout the county. The reason I'm bringing this up is because we've actually changed in the past, I would say about 1 to 2 years, to actually look at all substances. There's a pretty strong sense that we're missing an opportunity if we only talk about opioids in such a coordinated and, frankly, comprehensive manner, that we're missing other substances. That and the fact that most of the overdoses that are happening with multiple substances at this point. There's very little, if any, heroin. It's fentanyl. There's cocaine. There's other there's other substances. Alcohol is involved. And so we're continuing to move towards addressing polysubstance abuse issues as part of our opioid intervention team, recognizing, like I said, that this powerful tool is already in place. One piece of that is our overdose survivors outreach. And so this is where we have peers responding 7 days a week to non-fatal overdoses. So it's a way to try to get to people immediately after they overdose so that we can see what services they need and look to see if they're ready to be connected to treatment. We can provide that and make that transition easy for people. Typically right after an overdose is when people are most receptive to change. They've obviously gone through a pretty traumatic experience. This program is operating right now in partnership with emergency departments. So people who are there who are overdose, discharged, we follow up with them. And the same thing is happening to those who are engaged by the police. So there are segments of people who overdose. The police encounter them. They do not go to the hospital or get care. And so we follow up with them. Right now, we're doing that in partnership with the Anne Arundel County Police Department, and we're working with the Annapolis Police Department to get their data so we can do the same thing. We are doing it in the city, but it's a little bit of a slower response until we get the data in a more timely fashion. And then lastly, I wanted to talk about our work with corrections. We continue to provide methadone and naltrexone to incarcerated inmates at the Ordnance Road Correctional Center. It's really important to do that because the risk of overdose death is 40 to 120 times higher than baseline on reentry without treatment. And so this is actually a key place where being able to provide that treatment in the correctional setting allows people to, one, engage in recovery during their incarceration, two, successfully transition that once they do reentry. Part of that is that we're also going to be expanding that to the Jennifer Road Detention Center and expanding it to buprenorphine as well, and that puts us in line to be compliant with House Bill 116, which required all three medications, the naltrexone, methadone, and buprenorphine, to be available in the correctional settings. And so we're excited to be able to offer the buprenorphine and extend to Jennifer Road. Looking at our crisis response system, we've seen steady increase in service requests to the Warm Line, crisis intervention teams, the mobile crisis teams, as I mentioned, a marker of the increased both need but also availability of services. And then just wanted to share the data on the children's needs as well, which we also see increasing year on year. One of the programs that we have that's targeted to youth is our mental health stabilization services, and it's particularly for assisting youth and their families during a behavioral health crisis. So most of these children are being referred by either DSS or by crisis response when they encounter them in that setting. Excuse me. And we see that parents report improvement in the symptoms of their children who go through these mental health stabilization services. This is another key part of our treatment spectrum for youth in the county. Moving on from behavioral health, I'm going to highlight a few programs throughout the rest of the department. One is our HIV STI prevention and care program, and I highlight this particularly because we're increasing our linkage to PrEP services. PrEP is pre-exposure prophylaxis, so that's medication for people at high risk of getting HIV. They can be started on medication that will decrease significantly their chances of getting HIV. We've increased our access to services to that in the county and are making it available now so that you can get it at one of our 2 clinics in the county. One of the initiatives that we have going on right now is our preventive community health services. Out of COVID, we saw what the need was to address issues around access to preventive services, access to vaccinations, testing, education, and that frankly the two sites we have in Glen Burnie and in Parole here in Annapolis really just not enough for a county of this size. And so we spent a lot of time during the thick of the pandemic working out how we can expand our ability to get out into the community. So we now have a clinic at Lula Scott, but I think just as importantly, we're also now going out to a wide range of partners. We're working much more closely with the school system to bring vaccinations there. We're working with community partners like churches, libraries, businesses, and others to bring our testing, excuse me, testing, vaccination. We do mass distributions that way. And what this allows us to do is have a much greater presence in the community and get our services out. We were able to, as I mentioned, adapt that really quickly for the monkeypox vaccine, but we're also doing it for back to school vaccines. And it's helped with getting our vaccination rate in kids returning to school, make it really easy for them. Every year when we get to that 3-week or so deadline, there's a lot of kids, we're scrambling, we're struggling. By making the vaccines available in schools, it cuts out a lot of that. And those kids can just focus on education. And those parents who are clearly struggling to get them in for a visit don't have to worry as much. In terms of testing, obviously our COVID testing is one piece of this, but it's also allowed us to expand our STI testing, our pregnancy testing. These are just some statistics about what we've done. I think the key here is that it also allows us to go to other vulnerable populations. So our homeless shelters, expanding our work with corrections, our homebound program. So this came from No Arm Left Behind. And also our vaccine transfer program, where we've been able to transfer over 34,000 doses to providers of COVID vaccine. All in all, these are the kind of infrastructure building activities that have been really important and that we've pivoted away from COVID, not entirely, partially, to be able to do the wide range of things that we do as a health department. And our goal really is to make sure that we're going to continue to be able to do this going forward, because it has been such a key part. And our partners tell us that they want us to continue this. The people that we're serving tell us that this has been really important in helping them get what they need. And so that's something that we're going to be talking about more as we go along, is how we continue to strengthen that, fund that, and also look at where there are other opportunities to be in the community to be able to deliver these services that are frankly not happening for these individuals otherwise. Moving on to our Healthy Start Home Visiting Program. This is a program that provides wraparound services and supports to women who are have high risk pregnancies, or for postpartum women and caregivers with substance exposed newborns. One of the critical things that we're trying to do in this program is make sure that children are born without not low birth weight, so at a normal weight. Low birth weight has implications for future health problems, and that's obviously a significant concern that we're trying to address. And you'll see that in FY22, 36 of the 39 births were of normal birth weight, which is actually really, really fantastic data to see, because that is the evidence of the effectiveness of this program. Oops. Another program I want to highlight is our dental program. It really serves predominantly children, as you can see here. Children who don't have access to dental services otherwise. We do see a small amount of adults, and typically that's related to either our Ryan White program or emergencies or some or other specialized condition. But particularly, we want to focus on children because getting that, not just treatment, but preventive services for children helps with their oral health down the line. And one of those programs is our dental sealant program, which is being done in our Title I schools right now, 3 of those schools. And as we go along, we've talked with the school system, and we are looking to expand that dental sealant program to a greater number of Title I schools. Which is a good segue to our school health services, who we've talked about. It's been a long, strange road for the past few years. I think it's also a good moment to highlight how critical they've been to our entire response to COVID over the past few years. But they're more than happy, like the rest of us, to get back to just taking care of kids in schools as they return to normalcy. And then the last program I want to highlight is our rodent control program in our environmental health. This is a program that works with communities with the most complaints around rodents, and does a door-to-door survey to those homeowners who agree to it. Does a door-to-door survey and offers extermination services so that we can keep the rodent burden low in communities. Probably our biggest barrier is people not accepting us to do this, do the inspection and the extermination. And I can tell you that it causes a lot of consternation amongst their neighbors that folks are for not taking advantage of this, because those rats really don't observe property boundaries. So it's a key part of what we're going to look at is our outreach and education, not just ours, but also what those communities can do as well, because the more people who take advantage of it, frankly, the better the community does in terms of getting rid of those rodents. I always like to show this photo of the cat scared of the rat. That's what we're dealing with. And lastly is our beaches program. We don't often highlight this, but we do water quality and of our beaches to ensure that our beaches are safe for the public. For most of the beaches, for most of the swimming season, beaches are safe, but every once in a while we do see bacterial contamination in waters, and we put up alerts. And it's just another key program that we have that not a lot of people are aware of, but is a key part of how we maintain water quality and health in the county. And so with that, I'm going to conclude, and thank you for your time. I'm going to turn this off, and I'm sure you have questions.
Thank you very much. I'll just start by saying I kept writing down questions and then crossing them out because you answered them a few minutes after I wrote them down. Do any of my colleagues have questions that they'd like to ask? Ms. Pickard.
Thank you, everyone, for being here. First of all, Allison Pickard, District 2. I'm always, we only meet twice a year as the Board of Health, so I'm always amazed at the amount of work that you do. And so I want to thank you first for your work. I know it's been a long couple of years for everybody, so thank you for sticking in there with us. One of the things that we've been talking a lot about at the county level and really at the state is how across the country we kind of got caught with the pandemic. We have not invested in our public health infrastructure, not just here in Anne Arundel County, but across the country. I think that's a fair statement. But as we've been focused on education and public safety, I'm curious, and I don't know that you can answer this today, but I know that our county health department PINs have stayed very constant over the last decade. I know you're also supported at the state level, so I don't have that information at my fingertips, but I would like to know, again, probably not today, but if you were to have a goal of a level of employees to deliver the amazing services, what would that be? We're always analyzing that from police and fire and our teachers and bus drivers and all these other things, but it is very clear that the work that you do is vital to the quality of life of the residents of this county, and I think it's something we all need to be talking about a little more strategically. I'm sure you have plans of your, but we haven't actually really gotten there in any of these conversations. So I just wanted to put that out there today, and maybe we could have that conversation in the future.
We'd be happy to.
Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Thank you, Dr. Kaliana Robin. I have two questions, and one I know you've probably anticipated I'm going to ask you about. The other one, so I'm reading a lot about rainbow fentanyl. Do you have any thoughts, comments? We've got Halloween coming up. So that's just sort of a broad question on it overall from the public health perspective in the county. And the second question is on South County with some sort of a healthy farmer's market type of food. Where are we at with that? Thank you.
So I'll start with the rainbow fentanyl, and then I'll pitch it over to Tony for the second piece of that. We've been hearing about that. I haven't heard convincing evidence that it's actually happening, right? That I think there's been a bit more of kind of that panic hype around it, but we're always monitoring, particularly with HIDA, and getting the federal information on what's moving and what's not. So if that actually becomes a concern, we'll absolutely jump on that.
The second part of your question about the South County farmers market. So we have started the food assessment in South County for food security. And we're inviting the community out to kind of tell us what their barriers are, what are the things that they're running into. And that's started within the last 2 months. And if you all are looking for dates for when our additional meetings are, we'll make sure we get those to you so you know where to invite the community to come out and be heard and let us know what sort of issues they're running into with food security.
Perfect. You read my mind. Thank you so much.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Feather, District 5. Thank you all for being here this evening. So I have a question I believe that will fall under the Healthy Start Visiting Program. It more gets into the weeds of some information that I asked about, I think, at one of our very first meetings sitting as the Board of Health. Taking into account all of the numbers that we've seen through COVID kind of going up and they're coming back down, do we have any information on the neonatal abstinence syndrome babies that end up in neonatal intensive care and what those numbers look like? Because I know that those do tend to result in wraparound care through infancy and toddlerhood.
I don't have that at my fingertips, but what I can do is look at what our numbers are. One of the challenges we've had is just data in the past 2 years. We are not getting it in the same way, but I will check on that and try to give you at least, back 2 to 3 years, a time course of what's happening with that.
Okay, thank you.
Mm-hmm.
I'll jump in with a question of my own. Towards the end of your presentation, you mentioned rodent control.
Mm-hmm.
And I'm curious if any of the communities that you have visited are in the city of Annapolis, because I've actually, and if not, how do we get you? Because that's an issue that I've heard from constituents recently.
Yeah, I'm going to bring Don Curdy, actually our Environmental Health Director, to talk a little bit about that and what it would take.
Thank you.
Actually, none of them have been in the city of Annapolis. Most of them have been in the northern part of the county. So the way we assess when a community is part of our rodent control program is we analyze all of our complaints that we've gotten in the last year. And those that are the largest number that are substantiated, which always turns out to be Brooklyn Park, is one of the communities we always assess. And then communities after that. So we basically assess about 5,000 or so properties during May through November, and we hire summer rodent techs that can do the assessments to support the work. The enforcement work has to be done by my staff, so we can only do so many properties in a year, but none of them in the city of Annapolis have come up. So if you have some communities that we can be aware of, we can look at that, but we don't get that many complaints from the city of Annapolis for rodents.
Thank you. Are you in communication with HACA regarding because I'm guessing that complaints regarding rodents might only go to HACA, and if they wouldn't necessarily separately be reported to you.
And that may be part of the problem because we don't do housing complaints in the city of Annapolis because they have their own housing authority. So we do food, but we don't do housing. So that may be part of the problem. But if they have substantiated numbers that we can look at, we can try to look at this program in the city as well.
Okay, that'd be great. We'll be in touch. Thank you. Mr. Pruski.
Good evening. Again, thank you for the report. I don't know if you have to bring staff up or you can follow up with me. How many nurses are we short in schools? I know I've heard from a few parents that, because of the market right now, traveling nurses are making a hell of a lot of money. And of course, you do assessments on kids, and I know there was a state bill that require a school nurse at every building, which I think is great. But I was just curious, do we have any information? Because I know the school system posts that weekly update about missing teachers and bus drivers and cafeteria workers, but you never hear about the silent service of the nurses. So I was just curious if you knew how many were short.
Don't know off the top of my head, but we can get you an exact number, and Karen probably has it. So I'll call Karen Siska Creel up to answer that exact number. She keeps it on a daily. I can say that we've had more turnover this year even than we saw last year in our health assistants and nursing staff. So it's something that I think Karen and her staff have done a really great job at recruiting and coming up with really creative ways of getting nurses and health assistants in place. But it is a constant thing that we're kind of feeding more nurses into the system as we see that turnover. Karen?
Yeah, hi, Karen Siska-Curl, Director of School Health. To date, we have only one vacancy, which I am thrilled. Yes, we've had about 35 nurses resign since the beginning of July. It's been a lot, but we have been, as Tony mentioned, really knocking on every door, sending out mailers, running our own job fairs, and we hired a nurse today, and so we only have one vacancy left, knock on wood, so we're thrilled.
That is great. Thank you for sharing that.
And just a note, that's in good part because Karen and her team have essentially started up a shadow HR program to be able to deal with this. Because frankly, the needs in school health were outstripping the rest of our department. And so it's taken a consistent effort, but it is a lot. And it's not getting better anytime soon. She also mentioned that 35 nurses left, which means we have to hire 35 additional nurses to stay at that number. So it's a large amount of churn that's happening as well.
Well, I was going to follow up with what you said is the sustainability piece, because just like teachers right now, you might get them, but if another district is paying more money, and that's really the discussion I think at the state is that how do you have that sustainability piece, because you see people jumping. That's happening right now with educators, is that if another district is offering bonus programs, I know I just saw, again, detention officers in Anne Arundel County have this truck going around trying to sell their bonus and things like that. So it'd be curious to what we need to do to continue that, because one vacancy is just amazing, but I know that's not sustainable forever. As you know, what you said, 35 have resigned, because I do have some school nurses that live in my district. So thank you.
Yeah, thank you.
I have another question that I'd like to ask. You mentioned that the number of calls on the warm line had been steadily increasing over the past few years. Do you have any data or information to indicate why? Is that an increased awareness of the warm line, or is that an increased need for the use of the warm line? And is there even a way to differentiate?
Yeah, I'm going to pitch that over to Adrian.
Sure. Good evening. Adrian Michler. I'm the director for the Mental Health Agency. Actually, in FY22, there were close to 42,000 calls to the warm line. As indicated, that was a 30% increase for us. Most of the calls, we can break it down by type. We are getting that information. High anxiety, depression for mental health needs, but also a significant amount for housing, transportation, and other social determinants of health. We're very capable. Our staff is great. We have a lot of resources, and over 80% of those calls were able to be handled by the warm line staff. The other 20% were diverted to other departments within the crisis system, and we were able to accommodate those needs at that time.
Thank you. I'm looking to see, I don't see any other lights, but I want to look through my own questions and make sure. This is another mental health related question. Obviously, there's lots of different providers, but I know that, I don't know, at times in the past, access to mental health providers had been, really difficult. You'd call up a, particular organization and they'd say, oh, we have an appointment in 6 to 8 weeks and we'll call you back in 4, and you miss the call and then, whatever. But is the access improving for people that need mental health services?
Adrian Michler, Director of Mental Health Agency. We are working to improve access. Recently, we worked with Arundel Lodge to open an urgent care walk-in center on the grounds of Luminous Health. That's been very instrumental. We've recently heard of another provider who will be opening Saturday hours. We try to make sure that that information is available. Wait times are high, and we have some resources through the warm line to help people who need urgent care appointments to try to make those happen quickly without diverting to the emergency department. So it is kind of an industry problem, but we're working on it, and we've made improvements.
And it sounds like the urgent side of it is improved. If anything is improved, the urgent, the need for immediate access, and the crisis situations is improved. Is that correct?
That is correct, thank you. And one of the areas I know, as the health officer mentioned, that we're working on is prevention, because everyone post-COVID is experiencing increased anxiety, and making sure that individuals are able to know what resources are available and when to access what particular resource is really key. Like I say, it doesn't have to necessarily, well, we don't want it to become a crisis. That's key. So working on trainings for resilience and improving those skills, and training for mental health awareness, when to access certain levels of care is key. Working with primary care providers, all of that is part of what we're doing as a community to help our residents.
Thank you very much. And I have one last mental health question. Do we have any data indicating direction, improvement, decline for mental health of young people? Say it's like school age people. Whether the overall condition of the overall mental health of, school age people, is it seem to be improving? Do we even have data to sort of indicate one way or the other?
I'm not sure what indicators we would use. We're certainly taking an all-hands-on-deck approach with our mental health task force. We have developed a number of programs at every age level in every school. The inventory of resources and programs available is just pretty extraordinary, and we continue to make improvements there. As far as one of the things is making sure that school-based mental health is now available in all schools, working with guidance counselors, and an inordinate amount of trainings to school staff, administration, counselors, all of that. So we're setting up a wide net, we're hoping, and again, working on indicators. Yes.
Okay, thank you. I know there wasn't necessarily an easy answer, so I appreciate that. Any additional questions from my colleagues? I'm not seeing any additional lights, so I will just say on behalf of the whole council, thank you very much, Dr. Kalyana Raman and Dr. Michler, Ms. Michler, thank you, and Ms. Skedden, and the other health department leaders that are here. Thank you for your time today. It's always very informative and helpful, and thank you for the presentation.
Thank you.
And we'll see you some of us will see you in May.
Thank you.
Thank you. All right. To my colleagues, may I have a motion to adjourn as the Board of Health?
Allison Pickard, so moved.
Is there a second? All in favor? Opposed? The motion carries. The meeting of the Board of Health is adjourned. We will begin our regular legislative session next. So I'll gavel us out and gavel us back in. The October 3rd, 2022 legislative session of the Anne Arundel County Council is called to order. All electronic devices should remain silent. Please pause for the invocation and the Pledge of Allegiance, which will be led by Ms. Fiedler this evening.
Thank you, Madam Chair. We could all stand, please. I pray that your presence be with us this evening as we do the good work of the county residents. May we listen to each other, hear each other, have thoughtful discussion and considerations as we fulfill the duties that we were elected to do. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Ms. Fiedler. Madam Secretary, please read the ethics statement.
The Ethics Commission has asked that I advise you that under certain circumstances, members of the public may qualify as lobbyists when they testify before the County Council. If so, the law requires that certain information be filed with the Ethics Commission. The Chair of the Ethics Commission has asked that those who wish to testify in any form review the general information on lobbying sheet located on the Ethics website under Forms and Publications. If there are any questions about lobbying requirements, please contact the Ethics Commission at 410-222-4413.
Thank you. We will now open our invitation to audience. Madam Secretary, do we have any comments or communications on any subject not included in the printed agenda received from members of the public?
We did not receive anything ahead of time, Madam Chair.
Thank you. We will now invite members of the audience who signed up before the meeting to address the council on any item not included in the printed agenda. When your name is called, please come up to the table, have a seat, and state your name and address for the record. Remarks will be limited to 2 minutes. And I have on my list one speaker, Ms. Debbie Jason. You may come on down.
May I begin?
You may.
All right. Hi, my name is Debbie Jason. I live in Pasadena, Maryland. I am speaking on behalf of myself, not on behalf of anyone who's involved, any other individuals, or any groups or other entities. I have not been asked to make this disclaimer. I just thought that I should. For the past 2.5 weeks, an adult Pasadena resident has led a campaign to harm both a transgender teacher and a student in the school's Gender and Sexuality Alliance Club. She is harming queer students in Pasadena whose identities she has collected. She has outed a queer student in a Pasadena forum and outed who knows how many others in private messages after publicly offering to tell people if someone is queer if they PM her a name. She has maligned the character of a well-regarded teacher and encouraged accusations, name-calling, misgendering, dead-naming, and threats. She has gleefully and without permission shared embarrassing videos of a child who she is angry with, which have now been viewed thousands of times. She has encouraged disparaging comments about the child and written her own. And she has gathered a large number of Pasadena residents to stand with her to bully and harass this teacher and this child. The list you have there are the names I've been able to collect of participants in this campaign. The vast majority of those people are from Pasadena. You can see how prevalent the bigotry is in that area. I believe the teacher will be okay. She doesn't live in Pasadena and can transfer to a school in an area where people aren't so evil. I've heard that she's an amazing teacher, and she certainly deserves better than she has been treated by the many bigots in Pasadena. But the student is now at increased risk of harassment, bullying, assault, rape, attention from pedophiles, self-harm, and suicide because of the cyberbullying she has endured from these residents. And I believe that others in the school GSA who were already being harassed and sometimes assaulted by students and ridiculed by some parents and community members are now at increased risk as well. I don't think there's anything the County Council can do to resolve any of the issues I've spoken about. They'll be left to the police, courts, and school system to deal with. But look at that list.
Please conclude your
I've got
remarks.
one sentence. Pasadena, known throughout and even beyond the county for its racism, should now also be known for its homophobia and transphobia. Thank you for your time.
Thank you very much. All right, we did not have anyone else signed up, but if there is anyone else here who wishes to speak, please come to the table and have a seat. When it is your turn, state your name and address for the record. Remarks will be limited to 2 minutes. And seeing no movement in the audience, the invitation to audience is now closed. All right, moving on. Is there any item any council member would like to place on the agenda this evening? All right, seeing none, we'll move on. May I have a motion that the partial reading of any bill, resolution, amendment to a bill or resolution, or minutes constitutes the reading of the whole? Thank you. Is there a second?
Allison Pickard, second.
All in favor? Aye. Opposed? The motion carries. Madam Secretary, please read the minutes of September 19th, 2022.
The meeting was called to order by Chair Rodvian at 7 p.m. and opened with the invocation given by Mr. Pruski and was followed by the Pledge of Allegiance. The meeting was held in the County Council Chambers, Arundel Center, Annapolis, Maryland.
Thank you. May I have a motion to approve the minutes of September 19th, 2022?
Allison Pickard, so moved.
Thank you. Is there a second? Thank you. All in favor? Opposed? The motion carries. The minutes of September 19th, 2022 stand approved as read. Madam Secretary, please read the titles of any bills to be introduced this evening.
Madam Chair, there are no bills to be introduced this evening.
Thank you. Madam Secretary, please read the titles of any resolutions to be introduced this evening.
Resolution number 4522. Resolution approving the determination of certain improved county-owned property being part of the Dorsey Run right-of-way in Annapolis Junction, Maryland as surplus property. Resolution number 4622. Resolution approving the application of Stephen D. Hopkins and Mark D. Hopkins to sell an agricultural land preservation easement to the Maryland Agricultural Land Preservation Foundation on 1,139.830 acres in Lothian, Maryland. Resolution number 4722. Resolution supporting the Anne Arundel County Board of Education's fiscal year 2024 public school construction capital improvement program request for submission to the Interagency Commission on School Construction. Resolution number 4822. Resolution confirming the appointments of Anne Arundel County residents to serve on the Spending Affordability Committee.
Thank you. And because resolution number 4822 is an appointment, we will vote on resolution number 4822 once we get through all of our other bills and resolutions this evening. Madam Secretary, please read the title of Bill number 73-22 as amended.
Bill number 7322, an ordinance concerning subdivision and development and zoning cluster development.
Thank you. Ms. Fiedler, this is your bill. You may have the floor.
Thank you, Madam Chair. Amanda Fiedler, District 5. We've talked extensively about this bill. It expands ever so slightly the definition of cluster and adds some screening requirements to just improve the definition and hopefully avoid some of the situations we've had in the past.
Thank you. Mr. Barron, on behalf of the administration, if you would like to respond, you may do so.
Thank you, Madam Chair. Pete Barron with the administration. Joining me is our Deputy CAO for Land Use, Ms. Lori Rhodes. We also have Lynn Miller from OPZ and Kelly Kenny from the Office of Law. Nothing to add from our previous comments in all the other meetings. We've discussed this. Administration supports. This bill builds on many of the efforts that we've undertaken to address some of the problems in the past. Thank you.
Thank you. Are there any questions from the council? All right, seeing none, we will now open the public hearing on Bill number 73-22 as amended. Madam Secretary, do we have any testimony received from members of the public?
We did not receive anything ahead of time, Madam Chair.
Thank you. We also didn't have anyone sign up, but if there is anyone who wishes to speak on this bill, you may come up to the table and have a seat. When it is your turn, state your name and address for the record. Remarks will be limited to 2 minutes, and it does look like we have a speaker. Thank you very much.
Good evening. My name is Matt Minahan, 3651 First Avenue, Edgewater, Maryland. I'm here on behalf of the Growth Action Network and again is pleased to support this bill as amended because it clearly states the purpose for cluster development, to preserve and protect the natural features, conserve forest, provide open space for passive and active recreation, and integrate environmental site design without increasing density. As you know, GAN has historically had concerns about the way in which text amendments to the code and variances and modifications have allowed for greater density than the underlying zoning, resulting in one-off decisions being made without a full understanding of the cumulative impact of some of these decisions. GAN's been concerned for a number of years that the current code on cluster development has had loopholes that have been exploited, creating a negative impact on the communities in which they are located. We believe that 7322 is a good start at closing these loopholes and appreciate Ms. Fiedler's efforts through the months to get this over the finish line. We ask that you pass this bill, and we hope that the next council will further clarify the uses and conditions for cluster development and to work with the county executive to refresh, clean up, and update Articles 16, 17, and 18 in alignment with the themes of the GDP and the work coming out of the stakeholder advisory committees. Thank you very much.
Thank you very much, Mr. Minahan. If there is anyone else who wishes to speak on this bill, now is your opportunity to come on down. Seeing no other movement in the audience, the public hearing on Bill number 73-22 as amended is now closed. Madam Secretary, please read the title of Bill number 73-22 as amended.
Bill number 7322, an ordinance concerning subdivision and development and zoning cluster development.
Thank you. Any further discussion from my colleagues? We have discussed this one a lot, so let's, Madam Secretary, please call the roll on Bill number 73-22 as amended.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Bill number 7322 has been passed.
Thank you. Madam Secretary, please read the title of Bill number 78-22.
Bill number 7822, an ordinance concerning current expense budget, supplementary appropriations, grant special revenue fund, CAO contingency fund, capital budget and program, Woodland Beach Vol FS reloc, amending scope and description of project.
Thank you. This is an administration bill. Mr. Barron, you have the floor.
Thank you, Madam Chair. 7822 has two important components to it. First, the bill makes supplementary appropriations from the unanticipated grant revenues to the Community College Department of Health and the Partnership for Children, Youth, and Families. Additionally, it transfers $22,000 in the general fund from the CAO contingency to the Orphans Court to cover salary increases resulting from Bill 60-22. And second, the bill revises the scope and description of the Woodland Beach Volunteer Fire Station relocation capital project. The bill removes the second sentence of the description, which stated that the company's contribution would assist Woodland Beach Company in acquiring the property, as the fire department no longer requires the funds for purchasing the property. You all have a resolution that was just recently introduced that addresses where we'll be getting the land from the Board of Education. The remaining description simply states that the project will provide a county contribution toward the relocation of the Woodland Beach Volunteer Fire Station. The department will instead use the funds to help cover the construction and planning related costs. The team here is happy to answer any questions. As a reminder, we discussed this bill at the previous work session. Because we are adjusting a capital project, it does require 5 votes. Hopefully you all pass it.
Thank you. Madam Secretary, do we have any testimony received from members of the public?
No, Madam Chair, we did not receive anything ahead of time.
Thank you. We will now open the public hearing. We did not have anyone signed up ahead of time, but if there is anyone here who wishes to speak, please come up to the table and have a seat. When it's your turn, you may state your name and address for the record. Remarks will be limited to 2 minutes. Seeing no movement in the audience, the public hearing on Bill number 78-22 is now closed. Madam Secretary, please read the title of Bill number 78-22.
Bill number 7822, an ordinance concerning current expense budget, supplementary appropriations, grant special revenue fund, CAO contingency fund, capital budget and program, Woodland Beach Vol FS reloc, amending scope and description of project.
Thank you. Any further discussion? Seeing none, Madam Secretary, please call the roll on Bill number 78-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Bill number 7822 has been passed.
Thank you. Madam Secretary, please read the title of Bill number 79-22.
Bill number 7922, an ordinance concerning construction and property maintenance codes, nuisance properties enforcement.
Thank you. This bill is from Mr. Volkey, Ms. Pickard, and Ms. Fiedler. Whichever of you would like to speak, you may have the floor.
I can start. Thanks. Yeah, thank you, Madam Chair. So as the lead sponsor on this bill, I appreciate my colleagues, Ms. Pickard and Ms. Fiedler, joining. I think this is a pretty straightforward bill. The hope is that it will have some impact on Department of Health and inspections and permits and some other county departments in their ability to go after nuisance properties. Really, what started it for me is over the last 4 years, there have been a number of properties in my district where I have a constituent call me and maybe health has gone out and boarded up the property and they've gone out and done the weeded lots program, but it just continues to be a repeat offender of what I will call a sort of nuisance type situation. So in those situations, the county has really been hamstrung, and we've been told that's about as much as you can do. I have one particular property in mind that I won't talk about specifically, but I think the owner has done the calculus of what it costs for the county to fine them and come out and cut their grass during the summer, and they've realized that it's less expensive to do that than actually pay a lawn service to come and cut their grass, and that's exactly what we're trying to go after with this. So this will increase the civil penalties and the fines. It'll give a little bit more in terms of enforcement mechanisms for the departments, and the hope is that we can use this as a way to try to cut down on some of these nuisance properties in the county. So with that, I would ask my colleagues' support.
Would either of the other co-sponsors like to speak, or that sums it all up? All right, Mr. Barron, you may have the floor on behalf of the administration.
Happy to, Madam Chair. First, I think we spoke about this bill at the previous work session. Just to reiterate, the administration supports. We appreciate the sponsors working with the administration to make sure this bill achieves the goal. I'll echo Councilman Volke's comments that the code was limiting our ability to tackle this. This will be an additional tool to help address these nuisance properties. So with that, administration supports. Hopefully we'll be signing the bills shortly.
All right, any questions from the council? We will now open the public hearing on bill number 79-22. Madam Secretary, do we have any testimony received from members of the public on this bill?
Madam Chair, we did not receive anything ahead of time.
Thank you. We also did not have anyone signed up ahead of time to speak, but if there is anyone who wishes to speak, you may come down to the table at this time. Seeing no movement in the audience, the public hearing on bill number 79-22 is now closed. Madam Secretary, please read the title of bill number 79-22.
Bill number 7922, an ordinance concerning construction and property maintenance codes, nuisance properties enforcement.
Any further discussion? Seeing no lights, Madam Secretary, please call the roll on bill number 79-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Bill number 7922 has been passed.
Thank you. Madam Secretary, please read the title of bill number 80-22.
Bill number 8022, an ordinance concerning recreations and parks, civil offenses in county parks, enforcement.
Thank you. This is another bill from Mr. Volkey, Ms. Fiedler, and Ms. Pickard. Whichever of you would like to speak, and I see Mr. Volkey's light, you may proceed.
Thank you, Madam Chair. So again, thank you to my colleagues, Councilwoman Pickard and Councilwoman Fiedler, for joining on to this legislation. This one actually comes out of a lot of complaints that I've heard about dirt bikes. That's sort of what started it for me. It then has morphed into more than that. Ultimately, this is something that I believe Rec and Parks may have been asking for a long time, and hopefully we can give them this. My thoughts on this bill are pretty straightforward. It's going to expand the ability of park rangers to issue citations in certain limited situations. We've heard about boats that are moored in channels that are problems with DNR and Rec and Parks going back and forth. That was someone that we heard from a few months ago. We have this issue with the dirt bikes, and then on top of it, there's also an efficiency angle. Candidly, I don't know that we need the police to come out every time that we need to write some sort of a citation for possessing alcoholic beverages in a park. Ultimately, that's something that I think park rangers can do. So with that, this gives the authority to our park rangers to allow them to issue these straightforward citations. I think it's an efficient bill. I think it's good. I think it tackles some problems. Ask for my colleagues' support.
Thank you. At this time, Mr. Barron, you may respond on behalf of the administration.
Thank you, Madam Chair. I just realized I haven't introduced my team on the last two bills. 1,000 apologies, but I do have Erica Matthews and Chris Carroll from Rec and Parks with me, and Kelly Kenny from the Office of Law for this bill. Want to thank Councilman Volkey. I think we We also share the concern. This is an issue. The dirt bike issue is legit, and has been something that we've all been trying to tackle. Some of the other issues that you've recommended or referenced in as it relates to our parks, this will be a tool for our folks. So we're happy to support this bill and appreciate Councilman Volke, Councilwoman Fiedler, and Pickard working on this bill together with us. Thank you.
Any questions from the council? I will actually ask one. And I'm not sure, this may be something no one here can answer, but if you are a kid who has a dirt bike and you want to go somewhere to ride your dirt bike, where do you go?
Those things scare me. I've never been on one. I honestly, I don't know, and I don't know if anybody at the table. There are restrictions, obviously, on public roads and public property.
Madam Chair,
Oh, yes.
I mean,
If you have an answer, I would love, if you're familiar with something.
no, sorry, I was a little quick.
Oh, okay. So no, I know there must be some sort of places, because I hear kids say, "Oh, I got a dirt bike," and I know they're going places other than riding around on the roads and in the parks. So anyway, I was just curious what is out there. Maybe that's something, I don't know if Rec and Parks wants to tackle something like a dirt bike trail for dirt bike riders, but it does seem to be something that has interest. Anyway, that's another topic for another day.
Madam Chair,
Yes,
I will tell you other counties do have
dirt
public
bike parks.
facility. Yeah, and I will also tell you that I've talked to Rec and Parks about this, and it's not something that I think they're able to do yet, but it is on their radar.
Thank you. I appreciate that. Ms. Lacey.
Thank you, Madam Chair. This question is for Ms. Kenny. I have not myself received a citation for any of the conduct here, and therefore I do not know the procedure. When you get a traffic ticket, if you want to challenge it in court, the police officer has to show up, and if they don't show up, it gets dismissed. Would it be the same with all these citations for the rangers, or is it possible that we, would need to account for more of their time?
Kelly County Supervising County Attorney. So the process for these citations works similarly to our code enforcement, like zoning and building violation process. So they actually get put on the docket that those citations get put on. So it would require the ranger to come to court when they issue those citations. And if the ranger did fail to appear, then the defendant would more likely than not be found not guilty. But it does require the ranger to come to court.
Okay, thank you.
Mr. Volke.
Thank you, Madam Chair. Just a quick question, Ms. Kenny. There are already certain violations that a ranger can write a citation for, right?
Kelly County Supervising County Attorney. Yes, that's correct.
Okay.
There's about 3 or 4 that or I guess it's about 5 altogether that they can write citations for, and they have in the last couple of years. I think it was 2015 when they got that authority.
Okay.
And so we've handled just a handful of those that have been issued since then.
So they are already going to court on certain instances to deal with this?
Correct.
Okay, thank you.
Any additional questions? All right, moving on then. We will now open the public hearing on Bill number 80-22. Madam Secretary, do we have any testimony received from members of the public?
Madam Chair, we did not receive anything ahead of time.
Thank you. We also did not have anyone sign up ahead of time, but if there is anyone here who wishes to speak, please come up to the table and have a seat. When it is your turn, state your name and address for the record. Remarks will be limited to 2 minutes. And I do see we have a speaker.
I'm John Corin, 125 Hillcrest Lane.
Thank you for that testimony. If there is anyone else who would like to testify, now would be the time to come on down to the table. All right, seeing no movement in the audience, the public hearing on Bill number 80-22 is now closed. Madam Secretary, please read the title of Bill number 80-22.
Bill number 8022, an ordinance concerning recreations and parks, civil offenses in county parks, enforcement.
Any further discussion? All right, seeing none, Madam Secretary, please call the roll on Bill number 80-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacy.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Bill number 8022 has been passed.
Thank you. Madam Secretary, please read the title of Bill number 81-22.
Bill number 8122, an ordinance concerning zoning car wash facilities.
Thank you. Mr. Pruski and Ms. Pickard, this is your bill. And I see Mr. Pruski's light on. You may have the floor.
Thank you, Madam Chair. So the genesis of this bill is actually somebody reached out to Economic Development in my district, and they currently had a kind of hand car wash facility off of Route 198, and they were wondering what the code is in terms of properties and other pieces. And we kind of mentioned, obviously, in C3, C4, which is your gas station's high density, but they asked why wouldn't it be in C1 and C2? So I reached out to Planning and Zoning, and I said, what would be the way? Obviously, there's different ways you could do this. You could do conditional use, special exception, or just permitted. And the thing that kind of made sense, because our code is kind of set up on rural legacy, that we were a rural county and now we're more suburban and urban. And if you look at some of the adjacent jurisdictions, there's a wide range. But what are the concerns that would relate to a car wash in C1, C2? Well, there are two things. And I actually spoke to the 3 owners of my district when they were planning. Next to a residential neighborhood and also the road, because 2 things. You need cars at a car wash, right? You're not going to put it in a rural area, which some people raise concerns. And also making sure that there's a buffer. And the buffer is typically against residential neighborhoods. So that's why you have a 50-foot buffer listed here with any lot line as one of the conditions, and also a minor arterial road. Again, that narrows down the number of C1, C2 properties, and I thought that was reasonable with C1, C2. In addition, if you don't know this, people are keeping their cars longer and maintaining them. Car washes right now, while they're hot in terms of doing well with business sector, they also take a lot of capital investment. So if you think that there's going to be a car wash in every corner, I can tell you that's not going to happen. The amount of money that it takes to put in, along with the state requirements through MDE, from a business perspective, is very difficult. So again, I think this is a reasonable request, and I just wanted to give you a little bit of background that we did our homework in talking not only owners, but some of the residents that live near these. And thank you to Planning and Zoning for working me on this.
Thank you. Mr. Barron, if you would like to respond on behalf of the administration.
Happy to, Madam Chair. I have our Deputy CAO for Land Use, Lori Rhodes, Lynn Miller, and Kelly Kenny with me. I think the sponsor covered the bill very well. We support, appreciate everybody working together on this, and happy to answer any questions you may have, and look forward to having the county executive sign the bill. Thank you.
Any questions from my colleagues? All right, seeing no lights, we will now open the public hearing on Bill number 81-22. Madam Secretary, do we have any testimony received from members of the public?
We did not receive anything ahead of time, Madam Chair.
Thank you. We also did not have anyone signed up ahead of time to speak, but if there is anyone here who wishes to speak, please come up to the table and have a seat at this time. When it is your turn, state your name and address for the record. Remarks will be limited to 2 minutes. Seeing no movement in the audience, the public hearing on Bill number 81-22 is now closed. Madam Secretary, please read the title of Bill number 81-22.
Bill number 8122, an ordinance concerning zoning car wash facilities.
Any further discussion from my colleagues? Seeing none, Madam Secretary, please call the roll on Bill number 81-22.
Ms. Fiedler.
Nay.
Ms. Hare.
Nay.
Ms. Lacy.
Aye.
Ms. Pickard.
Aye.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
5 in the affirmative, 2 in the negative. Bill number 8122 has passed.
Thank you. Madam Secretary, please read the title of Bill number 82-22.
Bill number 8222, an ordinance concerning subdivision and development modifications notice.
Ms. Fiedler, this is again your bill. You may have the floor.
Thank you, Madam Chair. Amanda Fiedler, District 5. The bill is pretty straightforward. It would just require that the same group of individuals, organizations, and community leadership get notifications on modifications that they do with a pre-submittal community meeting. And I ask for my colleagues' support this evening.
Thank you. Mr. Barron, you have the floor to respond on behalf of the administration.
Thank you, Madam Chair. I've got the same team sticking with me. No objection to the bill. This is a good idea. We support.
Thank you. Any questions from my colleagues? All right, we will now open the public hearing on Bill number 82-22. Madam Secretary, do we have any testimony received from members of the public?
We did not receive anything ahead of time, Madam Chair.
Thank you. We also did not have anyone signed up ahead of time to testify, but if there is anyone here who wishes to speak, you may come up to the table and have a seat. When it is your turn, state your name and address for the record. Remarks will be limited to 2 minutes, and I see Mr. Minahan is joining us again.
Lots of good stuff tonight. Thank you. The Growth Action Network and the neighbors of the Mayo Peninsula both strongly support this bill. When the perimeter was expanded to 300 feet a couple of years ago, we advocated strongly that community associations be included in the notification process. We're thrilled that this is happening. Thank you again. And we hope this is voted upon unanimously.
Thank you. If there's anyone else who wishes to speak, come on down. Seeing no movement in the audience, the public hearing on Bill number 82-22 is now closed. Madam Secretary, please read the title of Bill number 82-22.
Bill number 8222, an ordinance concerning subdivision and development modifications notice.
Pardon me. Thank you. Thank you very much. I actually have one question. So I'm assuming that is there any guarantee that all the membership of any community association would be also notified? Or is that really just going to be left up to the person receiving the notification from the developer?
Thank you, Madam Chair. Amanda Feather, District 5. So right now, the residents that are in that 300-foot radius would be notified because it's what is stated in the code. The reason that this bill is coming forward is because those community points of contact, people of leadership, the community as a whole tends to trust that they will decipher the information and have it come down. So when they miss the notification of a modification, which is happening right now under current law, that piece is not disseminated into the community. So it would go beyond the 300-foot radius and get to the entire community and improve notification. Hope that answers the question.
So all of the membership would receive?
Based on who is on the list for those organizations, but the organization list is housed in the administration.
Okay, thank you. That clarifies. Ms. Lacey.
Thank you, Madam Chair. Is that the list that the Office of the County Executive maintains? I would assume that includes the property management companies. I'm just thinking about whether under this paragraph, is it contemplated that it would be legally sufficient for the developer or whoever is doing the work to be able to send notice directly to that property management company, or could it, essentially, like, are you saying in this bill that the president of a community or homeowners association cannot? I guess I'm trying to say you've got a delegation of authority essentially happening. That's what you're trying to do to expand the network of people who get notice of a proposed modification. But I'm trying to separate that from a legal duty of the person who's requesting the modification to make sure that they've gotten it out to the right people. And I wonder if this doesn't create some confusion in that, or at least I'm confused. Perhaps no one else is.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Feather, District 5. This may be a question for Ms. Rhodes or Ms. Kenny. Just to confirm current practice, what this is doing is taking the language that is in the notification section for community meetings upon pre-submittal and replicating it in the modification notification so that the same people are notified throughout the process. It's not as though, well, that's what's happening right now, is that the leadership, the HOAs, the organizations that represent peninsulas or a cluster of communities, they get the pre-submittal notification. But then if a modification comes up in the process, the 300 radius of residents get it, but then the leadership doesn't get it. So they kind of drop out of the communication, and this is bringing them back so that they're consistently through. Is that?
Kelly County Supervising County Attorney. Yes, I think that is correct. And to go back to Ms. Lacey's question about there is a list that the County Executive's Office keeps. So they do have a list of all the community associations and things of that nature that would be within that area that the developer would have to look at and make sure that they are sending that. And I believe OPZ does check and make sure that they go to the right places.
Thank you both. I just wanted to, I guess, add. I mean,
Go ahead.
I'm happy to support this legislation, but I'm not sure it really will do what you actually want it to do. But it doesn't seem to do any harm, so I'll support.
Mr. Pruski.
Just a follow-up question in the same vein, being a former community association president, they frequently flip. So that means there's elections or they defunct and then they come back. Ms. Kenny, whose lists would they go to? Because the county executive has one, there's other ones, so that's another thing. I think the bill's intent's great, but who knows what community? Because I know, again, I have one in my district that they kind of defaulted, they didn't pay their taxes, and now they're no longer on the list or notified. So how would they be clarified in here? How would that work?
Kelly County Supervising County Attorney. I'm not sure how often the list is updated with the County Executive's Office. I doubt that it's updated for every time that it goes in and out of good standing with SDAT. And more often than not, when that happens, there still is a mailing address that is associated with that community association, even if they're not in good standing, that will get to somebody. But that part of the burden is also on those community associations to make sure that they keep their information updated. But I'm not sure whether anybody from planning and zoning has any more information, but I don't know how that list is updated on a day-to-day basis, though.
Ms. Pickard.
So in District 2, my legislative aide we get notified as council members of modifications, and we in turn send it out to the community leaders so that in addition to the folks in the 300 feet. So now that will mean we won't have to do that anymore. So that's great.
All right. Let's see. We're moving to the public testimony, right? Is that where we are? I'm sorry, I lost my place with the train of thought. And I lost my page too. All right, thank you. We will now open the public hearing on bill number 82-22. Madam Secretary, do we have any testimony received from members of the public?
Madam Chair, did we
Did we already have this?
Because Mr. Minahan came up
I'm
and
so
said
sorry.
yes, I'm sorry.
That's okay. That's okay.
My brain is
We do
perhaps-
this 10 times in the same evening. I forget which bill we've.
It's very rainy and cold today. I think
Yes.
brains are sluggish.
Too many tabs open. I'll just. All right. Okay, so that was our further discussion. So seeing no further discussion, Madam Secretary, please call the roll on bill number 82-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard. Aye. Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Radvian.
Aye.
7 in the affirmative, none in the negative. Bill number 82-22 has been passed.
Thank you. Madam Secretary, please read the title of bill number 83-22.
Bill number 8322, an ordinance concerning, excuse me just a moment. Once again, it's cold and rainy today. Bill number 8322, an ordinance concerning scenic and historic roads, designation of roads, Furnace Avenue and Ridge Road.
Thank you. Ms. Lacey, this is your bill. You may have the floor.
Thank you, Madam Chair. I think brains are sluggish, but also tongues are sluggish, so if I misspeak, I apologize. We talked about this bill quite a lot at the work session. I hope you all took me up on my invitation to go drive on Furnace Avenue and Ridge Road and see what it looks like there for yourself. Since our work session, we received a preliminary analysis from OPZ that found that both road segments do qualify for protection as scenic and historic roads. We also received a comment letter from the Department of Natural Resources that explained the relationship of the two road segments to Patapsco Valley State Park. It's at least, I think you could say 80% if you're thinking about the road segments, 80% of those segments border the park. And while the letter concluded that further protection might not be necessary from the state's point of view, it certainly did not say that we shouldn't protect it or that any harm would come from protecting those road segments. I've also been able to go back through my emails. I was looking for evidence of conversations I know I have had with people at community meetings in that North Linthicum area. And the only thing I found in writing was, I like this idea. So I guess I didn't go flesh it out for you, but I do know that all of those residents drive these roads and they know from their experience. So they brought this up a couple years ago. It wasn't until this year in the spring that I started working on this actual bill, which seemed to me like a very neat way to solve a problem that the residents have, while also ensuring that we act consistently with our Plan 2040 to protect our scenic and historic roadways, as they're part of those resources that we want to protect, and direct our development dollars to roads that make much more sense for building up for traffic and all of those reasons. So I hope to have your support tonight, and I'll be happy to try to answer any further questions. Thank you.
Thank you, Ms. Lacey. Mr. Barron, you have the floor.
Thanks, Madam Chair. I have a bigger group with me for this bill, so let me remember to introduce them. Miss Lori Rhodes, Miss Lynn Miller, Miss Jane Cox, Miss Martha Zoom McIntosh, and also Stephen Kai Ziegler, our OPC director, here in the audience. If there are any questions, we also have Kelly Kenny sticking with us. So I think the sponsor and the administration agree at the core that these roads deserve protection. I think where we are diverging is how to go about it. So we can't support this bill tonight, and let me talk a little bit about why. The issue of scenic and historic roads is very important, and it does definitely deserve a closer look and possible future reforms, especially around the process for how roads are designated as scenic and historic. At the previous, I believe it was the previous work session, might have been I think it was the September work session. It's been a while. A council member asked us to undergo an analysis. We did a very quick one, and that analysis does show that these roads are fitting the criteria as laid out in the 90s and the early 2000s of what would qualify as a scenic and historic road. But what 8322 does not do is does not prevent or limit further development, particularly along Ridge Road, as the DNR note, particularly around Furnace Avenue, highlighted. Most of that's within a state park. That issue, that road is not a huge concern for us. What I do want to highlight, though, is 175401 and 176504 limit traffic mitigation efforts that the county can require of a developer to only safety improvements, which should be kept minimal. So this is exactly what our major concern is here, particularly 175401-2, which exempts scenic and historic roads from traffic mitigation or traffic adequate public facilities on that particular segment of road. So there are several developments that are in various stages of review that, if 8322 passes, would limit the ability of the county to require those developers to cover some of the impact of those developments along these sections of roads. They would still be required to mitigate on other sections. So this isn't a huge concern for us. Most of the effort would likely go on the other roads, but what we have seen in other areas of the county along scenic and historic roads is the collective impact of additional trips from multiple developments on or around those roads has required us in the past to spend taxpayer dollars to mitigate the impact rather than getting contributions from the developers on that. And that's really the concern we have on the Ridge Road portion of this bill. So if this bill passes, I can't tell you a dollar amount. We've talked about it. We've tried to figure it out. But there would be some impact if the county needed to take a further action to mitigate the trips along those sections of road. So I think I'll wrap it up there in saying, you know, the county execs and the administration do recognize what the sponsor is tackling here, which is how do we make sure we protect our roads and the communities around particularly scenic and historic roads. So while we appreciate the spirit of the bill, unfortunately at this point we cannot support. Thank you.
Thank you. Any questions from the council at this time? I have a question. This is probably for Ms. Kenny. If the county did feel that it needed to make mitigations on this section of road that's in the state park, what kind of, I don't know, obstacle is the right word, but what additional steps would that require? Since it would, you know, if widening, for example, if you're going to add additional traffic lanes, I guess you'd have to get some sort of permission, or what's the whole, like, what kind of process? Maybe that's not for Ms. Kenny. I don't know who that is. If there's someone that can answer that question.
Well,
Like,
I'll jump in first, but I'm sure Ms. Kenny or our folks from Office of Planning and Zoning can help. Significant limitations around the right of way, around what the county can, for a lack of a better term, mess with. It involves state land, so we would have to get the state to agree. So there could be a scenario where it wouldn't be a problem. The state would say, yes, please do this. But the state would have the final say for the property that is under state control. Hope that was accurate, and feel free to jump in if you got more to add.
thank you. Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. Along those same lines, I believe I saw this in the memorandum from Planning and Zoning. If the state independently wanted to come in and do something with that road, they can do that regardless, right?
Jane Cox with the Office of Planning and Zoning. Yes, our regulations wouldn't apply to the state. DNR has the ability to be able to do what they want on that segment of road.
Okay. I have a couple.
Yeah, go ahead.
Okay, thank you so much. So I'm looking at this map here, and it does look like, I mean, the vast majority of Furnace and then all of Ridge on one side and part of Ridge on another side is bordered by the state park. So as a practical matter, in terms of, I'm trying to understand the issue about development coming in along there and the need for mitigation. And so I started looking at this, and it really does look like a good portion of it is bordered by the state park on both roads. I guess that leads me to the next question. And this, I believe Mr. Barron addressed this in his remarks, and I had asked a follow-up question via email, so thank you so much to the Office of Planning and Zoning for responding to those. But I wanted to be very clear for anybody who's listening. Any project that comes in anywhere south of 295, because the designation stops at 295 under this bill, any project that comes in south of 295, they're not exempt from adequate public facilities. They're not exempt from testing. Their mitigation efforts would be targeted south of 295. Is that an accurate statement?
Yes, that is accurate.
If I may, I think there is a point though about the how the analysis is done, correct?
Yes. So while the proposed development may impact the roadway, they will not need to mitigate the impact. So while they may not need to study it, they will still be affecting the road, but they won't need to mitigate what their impact is on that segment of road if it's designated as scenic and historic.
Okay, so assuming that a development south of 295 impacted traffic, meaning it went under that bridge and went north on 295. North on Ridge, because there's that fairly low clearance, right? Okay, so assuming it impacted that, the mitigation would still happen south of the 295 roadway.
If that was part of the key study locations, they will need to mitigate what their impact is. If it's designated as scenic and historic, they would not.
Okay, all of their mitigation would focus south of that area.
Whatever would not be deemed scenic and historic.
Okay, and do I understand correctly that there's the state park on one side, the property that is not state park along Ridge Road is currently zoned RLD. Is that right?
Yes.
Okay, thank you.
If I may.
Go ahead, Mr. Barron.
Thank you, Madam Chair. I may not have been perfectly clear in my comments, but I think the part of the concern here is not directly development right on these segments. It's the cumulative impact around, and that's the experience we've seen in other places where the scenic and historic road might not have had the development right on it, but it is used by people who are brought in by surrounding developments.
All right, seeing no additional questions from, I'm sorry, Ms. Pickard, you may have the floor.
Thank you, Madam Chair. Allison Pickard, District 2. I just had a question about, in the conversations thus far, there are multiple industrial projects being planned that have already incorporated Ridge, at least parts of Ridge, in their adequate public facilities studies. How many of those have already made a plan to mitigate issues on Ridge? Do we know?
We currently have 4 who have approved mitigations for improvements along Ridge.
Okay, so what happens if this bill passes and what happens to those mitigation plans?
Well, they may, I would not be able to foretell, but if they choose to retest, then those improvements that have, those approved mitigations that have come out would not be tested for those that are deemed scenic and historic. And so therefore they would not need to mitigate those impact on those roadway segments.
Yeah, go ahead.
And then we had some conversations, possibly at the work session, possibly in the various phone calls I've had with various stakeholders. What about, do we have any information about our bike ped plans and bike lanes and shoulders for safety along these roads at all? I have no idea if that's part of any Move in Arundel sort of planning and what that means for scenic and historic.
Hi, well, let me introduce myself. Martha Arzu McIntosh with Office of Planning and Zoning. Right now, we do know that there is the Patapsco Greenway that will be traversing along Ridge Road and onto Furnace. There are plans that have identified those segments. Move and Arundel has not identified any bike plans, but overall in the county, there are the intent is to open those access in order to make it available for the road.
And if I could add, Steve Kizigler, Planning and Zoning Officer, I think the plan for that, it makes perfect sense. You want to connect folks down on Furnace Road and Ridge Avenue and those neighborhoods up into the park. The reality is going to be that the right-of-way width where Ridge Road and in particular Furnace Avenue come together is going to be difficult to expand to put a hiker-biker trail outside of that right-of-way because it does go through state property. And if I could also add, one of the, Councilwoman Pickard, you brought up the issue about mitigation. We have an interesting one. I agree with Martha that if a developer, one of the four who had agreed to mitigation, wanted to retest so they wouldn't have to do it, I doubt it's likely that that would actually happen. There's great risk in starting over as opposed to what we think are minimal mitigation improvements on Ridge and Furnace. For example, one of the development interests has to fix I'm going to say, a road failing issue so that it isn't made worse, it's made better. It's not causing a new failure. So they've agreed to remill and resurface Furnace Avenue. So it all stays within the footprint of the paved section of Furnace Avenue. We don't expand the right-of-way. And it's a relatively minimal amount of mitigation in order to ensure that the road rating of Furnace Avenue does not get worse.
Go ahead.
I actually had a, thank you, Mr. Kizigler, but I had a follow-up to so the state park has plans to add bike lane to Furnace or along the state park. So my question was, what does that mean if we now deem these roads scenic and historic? Is there any sort of issue for the state to actually be able to improve the road for a bike path?
So Steve Kizigler again. Based on our read of their response, it was, I'm going to say, a lukewarm, we don't really want to see this in scenic and historic roads. Our perspective is the state would prefer not to have Furnace Avenue or Ridge Road on the map. Because their perspective, and Jane can talk to this from the past, this has been evaluated extensively years ago, is that they believe that if Furnace Avenue and Ridge Road go onto the map, it will or may restrict their ability to do what they need to do in the park in terms of vegetative maintenance and a variety of other things. But it has been evaluated before extensively, I believe. Correct, Jane? So the comment from the DNR, I think, has to do with, to your question of the bike lane. If that was going to be a bike program that was put in by the state and it was state managed, we wouldn't have any say. They could either run it on the inside in their right-of-way or they could widen the road into their right-of-way. And so that road would widen without the impact of Article 17 protecting it. So to that, does that help answer the question? Okay.
Ms. Lacey.
So, thank you, Madam Chair. I had a couple of thoughts, and I think I've lost one. But one of the comments that was made, another way to think about this is about the people who might be coming based on these warehouses or whatever other projects are going to be built. Their employers can direct them for which way to go. They will definitely do that for tractor trailers. But more importantly, if we preserve these road segments, the point is people can enjoy a scenic drive. And we don't get to tell them whether or not they get to use a scenic drive to drive or not. If they don't like it, they won't use it. And the great thing is about this location is naturally, because of the features, because of the stream valley, the Patapsco River Valley, people don't use it. They don't use it now to such a degree that I don't get calls saying there's way too much traffic on this road. I do get people saying they're speeding on this road and the curves ought to, have you self-regulate your speed on that road. But if you know the area well enough, you would know that it is quite easy to access north, south, east, and west when you're heading south on Ridge Road, south of 295. That's why MDOT built their headquarters right there on that circle, Corporate Center Drive. I don't think those things are impediments, and I also I suppose I'll just say for the benefit of my colleagues, I really didn't get that impression of DNR's letter.
I'm not sure who is next. Okay, Ms. Fiedler.
Thank you, Madam Chair. Amanda Feather, District 5. So, Mr. Kai Ziegler, could you share any of the other mitigations other than milling and repaving that are, so that's one. So what are the other three? Do you know off the top of your head?
I can ask Ms. McIntosh to describe those. From our perspective, when mitigation is involved, they're all fairly minor. They are not big ticket expensive items. We're not talking about adding lanes, nothing significant that you might see in other types of development. So we're trying to be very sensitive to the nature of the road as it is. But Martha, can you share a few?
So in coordination with DPW and also our other agency partners, we have identified certain segments for overlaying pavement. We also are installing pavement markers in certain segments of the roadway. And so these are some of the improvements that we have identified. And there's no widening that has been proposed.
Thank you.
Ms. Hare.
Thank you, Madam Chair. Jessica here, District 7. That was actually going to be my question as well, and thank you for that response. But just to reconfirm then, so it's unlikely you think that those mitigations would somehow be stopped by a designation of scenic and historic. Those would move forward anyways because they've already been approved, and it would be unlikely that a developer would go retest.
That's correct.
Okay, thank you.
Madam Chair?
Yes, Ms. Lacy.
Thank you. Do we ever come up with a cost of the identified improvements, including like the pavement markers? Do we have a cost number for that?
Not with me right now.
Can you
I
give
can
me a
get it
ballpark
available.
of some kind?
No, not off the top of my head. I'm sorry.
Okay, so I think we're talking about a total of 2 miles of road, and can I guess a pavement marker is maybe what, $10 each, and you got to stick it on the road, so you need a person's time. What I've also asked for, but have not been given, and I know you mentioned this, Mr. Barron, that we talked about what are the costs of the other mitigations to other roads that would need to be done, and I think this is one way where we might be penny wise and pound foolish.
I wanted to ask a follow-up question. Maybe it was more clarification. There was a mention of a distinction between safety mitigation and traffic mitigation. And this designation would not, am I correct to say that this designation would not impact safety mitigation? So there still could be, the testing would still go forward and requirements could be made for safety mitigation.
Again, Steve Kaiser, Planning and Zoning Officer. If these two roads go on the map, it limits the county's ability to implement roads APF. And what we would not be getting, what would be exempt, would be certain analysis, certain road segments, and the mitigation that goes with it. We do reserve the right through the code to do what I would say is minimal safety improvements, which would probably not look like the mitigation that would normally be required. It would probably be oriented around signage, putting up additional streetlights, but strictly for safety perspectives. And on a historic and scenic road, frankly, we don't want to do improvements if we can avoid it, because that takes away from what it's supposed to be. So we would try and avoid safety improvements unless they were absolutely necessary.
So the improvements that are, well, at least I guess you've mentioned a couple for the developers that have already, gone through this process, those would not be considered safety? Or?
No, it would not be considered safety. It would be more considered in terms of mitigation of their traffic impact.
Okay, thank you.
Madam Chair.
Ms. Pickard?
Thank you. Allison Pickard, District 2. This bill is the first time this council in this term has dealt with scenic and historic roads, which has meant a sort of crash course in scenic and historic roads. I regret, Ms. Cox, not spending more time with you over the last 4 years. So maybe we'll get to know each other a little better in the next term if I have the privilege to serve. I've found this extremely frustrating, and I'm just going to acknowledge it. It's been an extremely frustrating process to understand. Unlike other processes that this council has undertaken with the general development plan and land use change applications, green infrastructure planning, there's extensive communication with property owners about changes in designations around their property. This is, to me, is a lose-lose situation. It's been presented in one light, and you dig a little deeper and you find a lot of other information. It's been extremely frustrating. So I actually still don't even know how I'm going to vote, but I just wanted to acknowledge for the audience, stakeholders, my colleagues, how frustrating this has been for multiple reasons.
If I may respond to that sentiment, I've been in the position since 2014. I inherited this program, and we have been consistently looking for an overhaul of the program because it's unclear in the process for designation, as we're finding out where we've gotten ourselves at this point. The applicability, even for what we have under Article 17, it was so poorly written, frankly, in 2005, 2006, that it's hard for staff to implement. It's hard to explain to developers and expectations of property owners. One of my concerns here is that there's going to be an unrealistic expectation from the public. If they think we can do a lot more with scenic and historic roads protection than the code actually allows us. So, there's a lot of elements of it that really, from my perspective, as having to implement this on a daily basis, it confuses us too sometimes.
Yeah, Madam Chair, if I may. And to further that, we already know, especially on Ridge, that there are underlying issues. I didn't go up today, but I know with the rain, I know there's flooding issues and other things that if we designate this road scenic and historic, it is going to limit not only what a developer can mitigate, but what the county is going to. So I really don't know what to do, to be quite honest. Thanks.
All right. Maybe let's go on to a public hearing. Maybe we'll get some wisdom from the folks testifying this evening. We will now open the public hearing. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we did receive one submission ahead of time that went to the entire council. It has been added to the record. It is also included in the summary that's posted online.
Thank you. We will now invite members of the audience who signed up before the meeting to address the council on Bill number 83-22. When your name is called, please come up to the table, have a seat, state your name and address for the record. Remarks will be limited to 2 minutes. And John Corrin, you're first, but Mr. Minahan, you knew the procedure. You can join as well whenever you're ready.
I'm up.
Yes,
Thank
go
you.
ahead.
John Corrin, speaking on behalf of Bicycle Advocates for Annapolis and Anne Arundel County, Bike AAA. Many of you know I also chair the County Bike Advisory Commission, but we have not convened on this, so I am not speaking on behalf of the Bike Commission. The Scenic and Historic Roads designation is paved with good intentions, but is fraught with unintended consequence, especially for people outside of vehicles. So we are all for preserving the scenic and historic nature of roads, and we're fortunate to have many in the county. But we're preserving them for people inside cars and actually inhibiting the ability for people outside of cars on foot or bike to safely use those roads, because the designation, as you heard, inhibits the ability to add sidewalk, add shared use path, add bike lanes, and other safety features, again, for people outside of cars. This council unanimously passed Move Anne Arundel, a heavy multimodal emphasis. People will not walk and bike to places unless we provide safe infrastructure. You passed Vision Zero, which emphasizes infrastructure that is designed for safety more so than throughput. This scenic and historic policy sort of flies in the face of that. The Walk and Roll Anne Arundel plan is in the works. The draft calls for a shared use path proposed on Ridge. This designation would inhibit the ability to do that. So I suggest pump the brakes on this bill and do an overhaul, as was mentioned earlier, on the entire policy. In fact, online from the Office of Planning and Zoning, it says, I'm reading, our office strongly recommends reconciling and resolving inconsistencies between bike ped goals with the scenic and historic roads preservation goals. So there you have it. I say pump the brakes on the bill.
Thank you. Mr. Minahan.
Thanks very much on behalf of the Growth Action Network. We've listened to this debate in the September Council work session and, of course, these last couple of meetings, and we support the administration in opposing this bill. This designation absolves builders and developers from updating or expanding the roads that have the historic and scenic designation. And just because a development is on the south end of that designation doesn't mean the traffic won't be headed north through the designated scenic and historic road. The areas that would be affected are already under intense development pressure. Several developments already submitted, industrial projects under review there. And the work of the Stakeholder Advisory Committee that for that region should not be subverted or undermined by creating this designation. It's also clear to GAN that the code for scenic and historic roads needs to be updated, agreeing with what John and what the staff has said here, to limit the type of development that can occur on or near scenic and historic roads, and to resolve the conflict between pedestrians, bikers, and scenic roads, particularly if developments are approved proximate to a historic or scenic road. In that case, developers should be required to make updates to the roads as necessary, and these are not burdens that taxpayers or the community should bear.
Thank you very much. Thank you to both of you.
One quick PS, and that is that Mayo Neighbors are having a candidate forum. We've invited Ms. Hare and Mr. Pittman, and also Ms. Alfreth and Ms. McDonald. We invite you to come as well, Thursday, October 6th, 7 o'clock, Edgewater Library.
All right, thank you much. In the spirit of civic engagement, I'll let that one slide. All right. If there's any, seeing no additional movement in the, oh, I do see some additional movement in the audience. You may proceed.
Thank you. Good evening, Chairwoman Rodvian and members of the council. Thanks for your time. Tonight, Kinley Bray on behalf of, I'm with the law firm of Yumkus, Vidmar, Sweeney, and Mulrennan. We represent two property owners, developers in the process of developing along Ridge Road south of 295, and we are in support of this bill. Just a couple of things I'd like to respond to that I heard in the debate. One is indeed Plan 2040 calls for a lot of development in this area, and to realize that will require millions of dollars in investment in Ridge Road South, but also risks requiring improvements along Ridge Road North and Furnace, which would be inappropriate given the scenic and historic nature of those roads. The Office of Planning and Zoning does not disagree that those roads meet the criteria for scenic and historic under the code as we have it today. That Scenic and Historic Roads map, I know you know, has not been updated since 2006 and in fact dates to 1997. This road hasn't changed since that time. We're not really sure why it wasn't included in the first place, but we do know that Plan 2040 now is asking or calling for the development of industrial in this vicinity, and that developers are seeking to go through this process and ascertain exactly what traffic mitigation and safety mitigation improvements might be necessary. This is a bill to designate. It doesn't do anything more. It doesn't relate to projects north of 295 because there aren't really any proposed at this time. There are a number, again, south of 295, and it's a unique situation. Due to the fact that it meets these criteria, it hasn't been included in the process before, and the unique constraints of the railroad bridge with an 11-foot clearance and barely enough width to fit two cars, we ask that you consider this designation tonight. Thank you.
Thank you.
Good evening, Madam Chairman, members of the council. David Plott, I'm an attorney with the Yumkus Law Firm, and with Ms. Bray, we have a couple clients that are south of 295 on Ridge Road. And I believe that this is really not a lose-lose, but a, Councilwoman Pickard, I'd say it's a win-win bill, because our clients are going to be developing warehouse projects that are going to generate mostly truck traffic. They're not going to go north. They don't want to go north on the road, on Ridge Road. They will access to the south where, you know, the major intersections are for 295, you know, all the major 100, all the major roads that are south. And that's where they will spend millions of dollars doing improvements, frontage improvements on Ridge Road, also making other improvements off-site to accommodate the traffic and the impacts that they will have on the traffic network. But the win-win is not only will the county get those road improvements, but people don't want to see a scenic road, which there's no dispute that this is a scenic historic road. The County Planning and Zoning Office has already made that determination. To make improvements and have to widen the road, because essentially you're at the point where there's no right-of-way to build any bike lanes or expansion. If you're going to expand this road, Furnace Avenue and Ridge Road, in the segments that are the subject of this bill, you're going to be cutting down specimen trees, you're going to be impacting steep slopes and environmental features, which I don't believe anyone wants. So by passing the bill, you will concentrate the mitigation dollars where it makes the most sense, you know, south of 295, and you will preserve what everybody agrees is the character of this road as a scenic historic road in perpetuity. In terms of flooding, I would see that as a safety improvement. If there's a flood condition, that can be addressed. As Mr. Kai Ziegler said, it doesn't prohibit safety improvements to the road. So I would ask that you approve this bill. Thank you.
Thank you very much, and thank you to this panel.
My
You are dismissed.
Thank you.
And if there is anyone else that would like to come down and testify at this time, now is your opportunity. All right, seeing no additional movement in the audience, the public hearing on bill number 83-22 is now closed. Madam Secretary, please read the title of bill number 83-22.
Bill number 8322, an ordinance concerning scenic and historic roads, designation of roads, Furnace Avenue and Ridge Road.
Is there any further discussion?
Madam Chair.
Ms. Lacy.
So I want to address the bike and pedestrian path point. You know, we always have to share roads. We share roads now. That's part of our legal structure. It's our behavior as drivers and as bicyclists and as pedestrians that causes a lot of problems. But the roads are there for everyone to share. And that's going to remain true no matter what happens with this bill tonight. But there are other creative solutions that could be pursued. For example, someone could ask the state DNR to implement a program of days where they close Furnace Avenue so that it's only allowed to have bicycle and pedestrian traffic. They could have some sort of program like that and put up, you know, signs that says every weekend these roads are closed, and then there's a balance. It's clearly not the only possibility, but I don't think we should let our argument points get in the way of creative thinking where everyone's needs can be met and balanced. Also, I would say is this a win-win or a lose-lose? I think if we, you know, our glasses aren't maybe clear enough because of the rain to figure this out, that what we can do at the very least is correct what can only be considered an omission, whether it was intentional or simply an oversight, of including these two road segments in the Scenic and Historic Roads program back in 2006. So we can put these roads on the same footing of the other roads in this program that we haven't touched since 2006. And then when a future council comes back to address these issues, to reform the Scenic and Historic Roads program, Furnace Avenue and this northern section of Ridge Road won't be left out again. Please vote in support of my bill. Thank you.
Thank you. I have another question. I'm sort of baffled that the idea of, you know, adding bike lanes wouldn't be considered a safety improvement. To me, that's the epitome of a safety improvement. bicycles are much safer when they have their own separate space. So how is this determination? What is safety versus what is traffic? Because to me, it's not intuitive. If there's anyone that can answer that.
No decision is made alone. We do have our partner agencies in DPW and also in inspection and permits who reviews the road segments that we're discussing. And so therefore, as a collective, we do think in terms of what will be the best solution for the road segments that we're reviewing. And so if identified are needs, and we do have plans that have identified where our bike lanes are, where our shared use paths are, where they need to be, and where we're programmed, and with our CIPs, we work together as a collective to make that happen.
So are you saying that a shared use path or a bike lane could be a safety mitigation?
To address that, I think the thing that we're dealing with on Furnace Avenue and on the segment of Ridge Road is the fact that we don't have anywhere for the road to widen because that is under the DNR's purview. So in a way, it's not our decision to make whether that's a safety decision because that land's not going to be available. And DNR, in our conversations with them leading up to the letter they shared, said that they're in fact discouraging any kind of additional access because they're concerned about access down to the river. So I think that that's an important thing to keep in mind when we're making a determination of safety. We couldn't even go down the road of the safety improvement by widening the road because that right-of-way is just not available and the DNR is unlikely to give it to widen.
Which also means that if we were to provide bike ped within the existing right-of-way, we're now moving pedestrians and bicyclists onto a road that's very narrow as it is, and we can be making, if you want to say, a safety issue worse as a result of that. And we apologize, it's really complicated. We understand, and this legislation that we're working with really does need an overhaul. I think it would be, if I could, have Jane give a little update or overview on what our evaluation entailed, because I think there's a perspective that it's kind of a slam dunk that it met the criteria. It met our initial preliminary analysis by a little bit, and I think that's important for the council to hear.
If I may.
Go ahead.
So the assessment that we did, this is the first time we applied the 7 criteria for rural designation. It's a fairly marginal standard to meet in that you only have to meet 2 of those 7 criteria, and they were very, very difficult to apply. It took a team of about 4 of us trying to really make sense of how to apply those criteria. So in both of these instances, those of you that received our assessment report, Furnace Avenue ended up having 4 of the 7 criteria, and Ridge ended up with 3. And the idea of the scenic historic roads, things that you really want to protect, should be 6 or 7. Those are the really pristine category 1, the most important preservation level of roads. So in a way, it was a marginal assessment to start with, and to go down the road of applying all of these criteria equally for a road that's kind of in the middle makes it difficult for us to apply down the road. And also to the question of it being an oversight in 2006, from talking to my previous colleague, Donna Ware, who was very involved with the program Genesis in the 1990s, she said that because, again, DNR was in control of so much of that property, they never even saw it as something to be concerned about or worried about, and that's why it wasn't ever put on the list and considered.
Thank you. Oh, I see lots of lights. I'm just going to go right down the road. Mr. Pruski.
Thank you, Madam Chair. I just want to clear something up because I know that we've had this discussion, and I think Councilwoman Pickard kind of said it right about definitions and what they mean. But let's be absolutely clear here. No developer is getting away with no mitigation. This is where the mitigation goes. Because I heard some public testimony that I'm very concerned about, that folks are watching and they're like, oh yeah, somebody's getting out here. The question is where the mitigation goes and where it has it in the means test. Am I correct? Can somebody please verify that in terms of how this works? I mean, because I don't want somebody to think that, that all of a sudden now somebody's, not using a different test or whatever. I mean, we've kind of gone through that, but can you clarify that, please?
And Councilman Pruski, I'll let the experts, but as a layperson, I think like most folks watching, as I understand it, as the way that the code is set up, by taking these out of the equation of the analysis and the where mitigation can go, it could change how much mitigation is required. Is that correct?
That's correct. Could, but the Office of Planning and Zoning through means tests would decide what should be improved, whatever else. That's why we have these tests. Am I correct?
Absolutely,
Yeah.
that we would still go through the
Okay.
adequate public facilities. I think where the administration's concern goes back to recognizing the sponsor's intent here and recognizing our sort of convoluted or Byzantine scenic and historic roads code that we have to work with, which we all recognize is flawed. What we keep going back to is some of the experiences we've seen in other parts of the county. Conway Road is a good example where a developer was able to build a large development. Everything's different than what would go on Ridge, obviously, but that Conway Road was then not included, which then leads to a very large county capital improvement project that will be on Conway Road. Would the development community have paid for all of that? Almost certainly not. But some of it would have been lessened had the Conway Road improvements been allowed to be included in that traffic APF.
Yeah, Madam Chair, if you don't mind if I follow up. That was age restricted and removed, so there's other factors too, and I agree with you.
A hundred, that's a very large, but that's probably the extreme scale, and this is, an ant compared to the mountain of that one. But it is still a significant impact. And that, again, like I said, to in my initial comments to this council, we're concerned about this bill. We would prefer to reject it. Does not mean that we are not concerned about the problem that the sponsor has identified, particularly how to ensure that as development is occurring in that region, that these roads are protected.
And just as if you don't mind, Madam Chair, as a follow-up, I'm looking at the CSX underpass here. I mean, I don't know who in their right mind would put a bike path or walking through that. And I've dealt with that in Odenton on 5th Street because somebody suggested that at one point. So I understand there was a comment made, but let's be honest here. We need to know where the bike path would go would be safe for the bikers as well when we decide that. So just food for thought about, whether it's a scenic historic or not. Again, just looking at the pictures, and I have driven by here as well. So, well, thank you.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Feather, District 5. So I actually, I just want to clarify the bike path conversation. So moving Arundel and our initiatives to have more shared paths countywide was mentioned as a reason to potentially not pass this bill this evening. But we also identified that the state could add bike paths if they so choose to. But then we also acknowledge steep slopes and not enough right-of-way. So I don't, and putting bikers on roads is not safe. So I don't know how relevant concern over a bike path really is at this particular place. And I appreciate the example of Conway Road, but unlike other legislation that this council looks at, which typically applies countywide, this is very specific. And I did drive this shortly after the work session, like I said I would, Miss Lacey, and I literally can't get around this tunnel overpass and how limited it is. So that certainly has influenced my decision tonight. And not really a question, but just recapping what I heard.
Ms. Hare.
What's very evident this evening is how factual these inquiries really are, very specific to each area. And I think everyone here has really done a deep dive into what's the property around it, where is this going, the CSX bridge, all of these other things. I absolutely agree with the comments that we should be looking holistically at the code and the biking regulations and how those interact with scenic and historic roads. There's a number of scenic and historic roads in District 7, and certainly that's an issue on that respect. But looking at this specific, I'll say thank you to everyone who's answered all of the questions. Thank you to the sponsor who's answered a number of my questions. I look at this and I'm going to fall down on the side of supporting this legislation this evening. I just think understanding what it looks like, the mitigation that's already been approved, that's going to continue anyways, knowing that the state owns so much of the property and the road mitigation that's being asked of already is more on the safety side with repaving or putting markers and things like that. It seems to make sense in this particular instance. But this has definitely highlighted a need for some other looks at the code much more broadly. So that's all. Thank you.
If I may, Madam Chair.
Go ahead.
I think, Councilwoman Hare, I think you referenced something that's important. The specific facts matter here. And I think we all would agree that these segments of road probably fit the criteria. Where the administration came down on that analysis is the impact on the roads and on the area, if this bill passes, will mean that let's not talk about the developments that are already agreed to mitigation, although as Mr. Kaisler stated that they would be unlikely to retest, although they would have that ability. There are others that are coming online, and that will mean that they will not be included. So these sections of road will not be included in their analysis. So that will have some cost on the county CIP. If the county has to take up additional mitigation that could have been covered or contributed to by the developing community.
I have a few more questions. Is it fair to say that the actual impact from the development that is being built, further down Ridge Road is actually not going to be on this segment of Ridge Road?
Are you saying the development itself?
Any impact on the roads? Any impact on the roads that would stem from this development on Ridge Road? Is it fair to say that impact is going to fall primarily on the parts of Ridge Road away from the part that's in the park and up near Furnace Road? Is that fair to say?
Yes.
The actual impact?
Because they're accessing south of, but that does not preclude that they will not be traveling up to those road segments and having an impact. Because we're not only talking about truck traffic, but we are talking about vehicle traffic as well, who are able to traverse across the bridge.
And if I may, one of the larger projects is not industrial, it's a residential project, which will have significant trip generation, as will the users using the industrial uses. They will not be necessarily driving their semi-trucks home. They will live somewhere in the vicinity and drive to work. It's going to increase trip generation significantly on Furnace and Ridge, north and south.
Madam Chair?
Yes.
To comment on your question, trailers, trucks from the warehouses, let's say your warehouse, I don't know the specifics of the numbers of trips, but certainly the trucks are often the most visible impact that you have, right? Noticeable. If they go north on Ridge Road and north of 295 and they intersect Furnace Avenue, they have no way to turn around at that spot. There's not nearly enough room, sight, the angle is bad. If they turn right, they send themselves straight to CSX Rail Bridge hell and have to figure out how to turn around, okay? And if they would have gone left, they'd go to the Elkridge Furnace Inn in Howard County, which sounds nice, but if you actually drive Furnace Avenue through that part of Elkridge to try to get yourself out to Route 1 or 895, 695, 195, any of those other major roads, you will only do that once before you realize that you should have gone south.
That's kind of what I was thinking. Unless all the other routes were completely backed up or something, then Google Maps is going to tell you to go not on Ridge Road north of 295 for almost any trip out of this area. I'm obviously really stuck here. Ms. Hare, you've got your light on.
Thank you, Madam Chair. Jessica Hare, District 7. I just want to confirm one more time. So these projects that you say will generate significant trips, but the projects that are already have approved mitigation, not one of them is to widen the road currently.
Correct.
Okay.
All right, I don't see any further lights, so seeing no further discussion, Madam Secretary, please call the roll on bill number 84. Oh, sorry, I got ahead of myself. 83-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacy.
Aye.
Ms. Pickard.
Nay.
Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
6 in the affirmative, 1 in the negative. Bill number 8322 has been passed.
Thank you. Madam Secretary, please read the title of bill number 84-22.
Bill number 8422, an ordinance concerning general provisions, flags on county property.
Mr. Volkey, this is your bill. You have the floor.
Thank you, Madam Chair. Straightforward bill. I think everybody's had the opportunity to read it. We discussed it at the work session, so I would ask my colleagues' support.
Mr. Barron, you may respond on behalf of the administration.
This bill is unnecessary and divisive. Please defeat.
Any questions from the council? All right, seeing none, we will now open the public hearing on bill number 84-22. Madam Secretary, do we have any testimony received from members of the public?
Yes, Madam Chair, we did receive 4 submissions ahead of time. They all went to the council. They've been added to the record. They're included in the summary that is posted online as well.
Thank you. We do have one person signed up to testify, so I will now invite that member of the audience who signed up before to come and address the council on bill 84-22. When your name is called, please come up to the table, have a seat, and state your name and address for the record. Remarks will be limited to 2 minutes. And John Jason, you have the floor when you are ready.
Thank you very much. John Jason, resident of Pasadena, Maryland, for over 25 years. The council should vote nay on 84-22. From a technical perspective, this bill is flawed. A simple interpretation of the language, private persons or entities would prohibit community leaders, scouts, veterans, and who knows whom else from participation in a county flag raising ceremony. Is this the intent of the council? Intent's an interesting word. I think we can guess at the intent of the author. I would like to know the intent of everyone else on the council as you vote no. I yield the rest of my time.
Thank you. If there are any other members of the audience who would like to come down and speak at this time, you may come on down. I see Mr. Enright. You may have the floor when you are ready.
Good evening, Madam Chair, members of the council, members of the staff. My name is Patrick Enright. I live in Huntwood Drive in Gambrels. I'm here tonight to oppose Bill 84-22. I examined the bill and asked the critical question, is this bill needed? Needed. My answer was obviously absolutely not. No, it's not needed. I believe that it's a solution looking for a non-existent problem. It's a waste of the council's time and effort. I checked the Shurtleff versus the City of Boston SCOTUS decision, which addressed, and much to my surprise, addressed 2 types of free speech. 1, government speech to set policy, and 2, private speech for the citizens to express their desires and opinions. I submit that if this bill passes, it would mean that the legislative branch is prohibiting the executive branch from exercising its government free speech under the First Amendment to set policy on the use of county flagpoles, which by extension prohibits the citizens' private speech of expressing their opinions by requesting to fly a flag, a banner, or a sigil on the county flagpoles, which In the short-lived case, the Supreme Court unanimously, but in piecemeal, upheld the rights of the private free speech from private citizens. So I think the council should focus on really important issues like we already did tonight, and please vote this bill down utterly. Thank you.
Thank you very much. If there's anyone else who would like to testify on this bill, please come forward at this time. Seeing no additional movement in the audience, the public hearing on bill number 84-22 is now closed. Madam Secretary, please read the title of bill number 84-22.
Bill number 8422, an ordinance concerning general provisions, flags on county property.
Any further discussion from my colleagues? Oh, I'm not sure. You guys were, I think you're at the same time. So Fiedler, you're up.
Thank you.
Oh, and Miss Lacey.
Thank
Sorry,
you,
Miss
Madam.
Fiedler. That was really very
It's okay.
too informal.
I have 3 boys. We go by last names at sporting events all the time. Amanda Fiedler. I'm going to go back to a conversation that we had during the work session, which I think the Office of Law memo touches on a little bit. Current policy is that no outside parties are allowed to fly flags or raise flags on any county flagpoles, correct?
I guess I'll answer that. Kelly County Supervising County Attorney. There is no written policy, but I believe that the county gets little to no requests for third parties to fly flags on county flagpoles.
Madam Chair, may I ask a follow-up?
Yes, go ahead.
Okay, thank you. So without the bill in place, at some point in the future, a county executive could decide to open that up, and at that open up a flagpole on a county property to be used by outside parties. And if that were the case, if I'm reading the memo correctly, anyone and everyone would have to be allowed to use that flagpole if that was the policy made by a county executive.
Kelly County Supervising County Attorney. Yes, that is correct. If there was a policy to allow third parties to put flags up on county flagpoles, then the county can't pick and choose based on content.
Okay, may I ask one more
Yeah,
follow-up
go
to this
ahead.
question? Okay, thank you, Madam Chair. Amanda Fiedler, District 5. Would that be way of an executive order or just an internal memo from a county executive? How would that work?
If there was a policy in the future to allow that?
Correct, yes.
Kelly County Supervising County Attorney, I think that could be by a couple of different ways. That could be by written policy, by administrative procedure, or by executive order, or even an unwritten policy.
Okay, thank you.
Any additional questions? Oh, Ms. Hare.
Thank you, Madam Chair. Jessica Hare, District 7. I wanted to follow up on a comment we just heard about folks participating in a flag raising ceremony. The way I understand the bill from a legal perspective is just that an outside group may not, no outside group, doesn't matter who they are, may not come in and use a county flagpole to fly a flag of their choosing. But if the county has some sort of a ceremony with a flag, that outside groups may participate in that no differently than they do now. Is that a correct understanding?
Right, Kelly County Supervising County Attorney, that's correct. So this bill would only prohibit third parties from putting a flag up on the pole, but it would not prohibit government speech. So in the example, I think at the work session of the Ravens, if they won the Super Bowl, then the county could put up a Ravens flag, and that would be government speech, and of course people could come and watch that.
Okay, may I ask one follow-up? Thank you, Madam Chair. So just by way of extension, okay, so the county could fly the Ravens flag, or if the police department is flying a certain flag, or the libraries want to fly a certain flag, whatever entity that is within the county can still choose to fly their flag subject to whatever internal policies the county executive might have.
That's right.
Okay, thank you.
I'm going to jump in because I have a question that really follows up on what Ms. Hare was just asking. Going back to the Ravens scenario, would the county be sort of opening the door to all comers if the county invited, say, for example, I don't know, the MVP of the game to be participating in the flag raising? Would that open the door to sort of anyone and everyone, if it was by invitation?
Kelly Kenny, Supervising County Attorney. I think you're just asking whether by invitation to just attend or pull the strings. Right. I see that as different than, it probably wouldn't be the Ravens, but, somebody coming and asking the county, can I use your flagpole and put my flag up with no involvement from the county, as opposed to this scenario where the county would be saying, we support the Ravens, we're going to put up a flag, and I think you could ask anybody to actually pull the strings on that.
Okay, so I actually meant it the other way around. If the county were to invite someone to come, say, hey, we want to honor the Ravens, will you send one of your players to actually hoist the flag? That wouldn't open the door.
No, I think the door would be open if the county had a pattern and practice of just taking invitations from different groups saying, I want to put up my flag on your flagpole.
Okay, thank you. Ms. Lacey.
Thank you, Madam Chair. So I have just comments, I think, not really questions, but this is number one. It's a beautiful constitutional law discussion that will definitely be on the bar exam for any attorney wannabes who are listening. So think about that. Second, I wanted to compliment my colleague on distilling this bill down to the very tiniest possible kernel of a way to state what you would hope to accomplish. And I think an instinct in any council member to try to protect the county from liability is just, not something that should just be dismissed. So it should be taken seriously and thought of, because maybe it is a good idea. And if the county doesn't have a written policy about flagpoles at this point, then I think we're on notice that it would be wise to have one. But I also want to compliment Mr. Enright for his comment about the legislative branch trying to, in any way, sort of curb the speech of the executive branch. We only have a limited ability to do that. And I think it's maybe much more fun to think about, what if a county executive decided to offer a flagpole for sale? And to say whoever is the highest bidder, they have the right to put up whatever flag they want on the flagpole for a day. And, this is a great revenue generating initiative. Even if the government did that by way of an actual exchange of a license for a day, basically, for money versus just people just sign up for free speech, the government would still not be able to regulate the content that it has opened up to everyone who will pay money to put this flag up. And so I think the dilemma is really revealed as being more about overall free speech and our values of free speech. And you can think of Russia. There is no way in heck Russia would ever allow any flagpole in that country to be used by any community group or anybody with any message, period. And we're not that country. And so to me, it's not only that I think this is unnecessary, and I agree with those who have said that, but more than that, I find it repugnant, and I probably mean a less strong word than that, and I can't think of it right now.
Mr. Pruski.
Thank you, Madam Chair. It was referenced earlier that the county executive, the county council can tell the Board of Education or library system to do. Ms. Kenny, I'm not an attorney, but I play one on TV. Can you verify that we don't tell the library they're independent, and also the Board of Education is a state agency independent of the county council, even though we may fund them?
That's correct. Kelly Kenny, Supervising County Attorney. Both of those entities are separate from the county.
Thank you. And I also want to thank Mr. Enright again for pointing out the legal ramifications of the case. Again, if there's something not broken, why try and fix it? Again, I think this is creating a problem that we don't necessarily need. May disagree, but I think we need to move forward.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Fiedler, District 5. So just want to make sure, because this bill is a little different than, or actually a lot different than a previous bill. This bill, if it were to go into effect, would not prohibit any flags. It would just state that only the county can fly flags on county flagpoles.
Kelly Kenny, Supervising County Attorney. That's right. That's how I read it.
Okay, Madam Chair, one more follow-up. So if our current policy is not to allow, or we haven't allowed, would you summarize this bill as codifying current policy?
Kelly County Supervising County Attorney, yes, I think that would be correct.
Okay, thank you.
All right, seeing no addition, oh, Mr. Volkey.
Thank you, Madam Chair. So it is interesting to hear people talk about how this is a solution in search of a problem, because what we basically are doing is trying to preempt any kind of problem that could come up. And generally, that's thought of as being forward-looking legislation. Generally, we say, oh, if we can anticipate something and sort of cut it off at the pass before it comes to fruition, that's positive. But in this case, it's sort of been turned on its head, and it says, well, this is totally unnecessary. This is a solution looking for a problem. Well, what often happens, at least in my experience in government, is problems develop, and then people come back and they say, how is it that nobody thought about this before? How did no one consider that this could come up? So in this instance, what we're doing is considering something that could come up in light of a Supreme Court case that came down earlier this year, and we're trying to codify existing practice. And I don't think that in any way we're impeding the ability of the executive to fly any flag that the executive elects to fly on government property. It simply makes it clear that in doing so, the executive is saying this is what we're going to fly. It's not some private individual. There is very clear government speech there. So ultimately, I think for these reasons, it just makes sense. If my colleagues disagree, that's why we all got elected, we can take a vote. But ultimately, this is trying to preempt what could become a problem. It's doing it in the narrowest possible way, and it's doing it in line with a recent Supreme Court case, which actually makes it pertinent to the conversation that we're having. So I would ask my colleagues' support on this, because I do think it makes sense, and I don't believe that you're in any way infringing on any person's ability to speak. What we are doing is clarifying what is government speech, particularly when using government resources. Thank you.
All right, seeing no additional lights, Madam Secretary, please call the roll on Bill number 84-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
I very much appreciate my colleagues' comments just now, but I will be voting no.
Ms. Pickard. Nay. Mr. Volkey.
Aye.
Mr. Pruski.
No.
Ms. Rodvian.
And I'm falling down in a similar place as Ms. Lacey. I do appreciate this, but I think I have reservations because of the origin of this whole conversation. So I will vote nay.
That is 3 in the affirmative, 4 in the negative. Bill number 8422 has been defeated.
Thank you. Madam Secretary, please read the title of Resolution number 37-22.
Resolution 37-22, resolution approving Anne Arundel County's 2022 financial assurance plan for compliance with the National Pollutant Discharge Elimination Phase 1 Municipal Separate Storm Sewer System Permit.
Thank you. This is an administration resolution. Mr. Barron, you have the floor.
Thank you, Madam Chair. I have Eric Michelson from DPW in Kelly County, who is sticking with us all night. Resolution 3722 approves the county's 2022 financial assurance plan for compliance with the National Pollutant Discharge Elimination System Phase 1 Municipal Separate Storm Sewer System, which thankfully they've shortened to the MS4. State law requires the county to submit the plan to the Maryland Department of Environment every 2 years to demonstrate that the county has the financial means to achieve its permit requirements. To meet this requirement, the county's financial assurance plan, project restoration, and MS4 compliance activity costs through FY27, along with projected revenues from funding sources listed in the plan over the same period. The project costs through FY27 are $477 million, and $486 million in revenue is expected, demonstrating the county's financial means to achieve the permit requirements. Our experts are here. If you have any questions, we ask you pass this resolution tonight.
Thank you. Any questions from my colleagues? All right, we will now open the, what's up? Oh, sorry,
I
the
was
light
late. I was
out
late.
of the corner of my
I
eye.
was
Go
late.
ahead, Mr. Volkey.
You know, I've been
I was
quiet
like,
tonight
what's going on?
because I promised we would be a quick meeting. All right. I just want to say I asked this question, I think it was 4 years ago almost, when we had this in front of us for Resolution 319. I said, are you going to give any of the extra money back to the taxpayers that you don't spend? And I just want to tell you, Mr. Michelson, after 4 years of seeing these projects go through this council and seeing the increased requirements of what you all have to do in terms of mitigation, well, not really mitigation, but stormwater management, I think you guys are doing a good job. So I'm actually going to be supporting this tonight and voting in favor of it, which, you know, I'm not too proud to admit sometimes when you learn a little something. And so in this, I appreciate the patience that your department has shown over the last 4 years and the diligence that you put into this plan. So in a rare moment, I want to give some kudos. Thank you.
Ms. Fiedler.
Thank you, Madam Chair. Amanda Feather, District 5. I just want to echo the sentiments of my colleague. We've stood in some interesting places with water in some interesting places. And I appreciate the work that you do and the education that you've provided. And I, too, am going to be supporting this bill tonight.
All right. Madam Secretary, do we have any testimony received from members of the public?
No, Madam Chair, we did not receive anything ahead of time.
Thank you. On that note, we will now open the public hearing on resolution number 37-22. We also did not have anyone signed up to speak in advance, but if there is anyone here who wishes to speak, come down to the table at this time, and we would love to hear your thoughts. All right, seeing no movement in the audience, the public hearing on resolution number 37-22 is now closed. Madam Secretary, please read the title of resolution number 37-22.
Resolution number 3722, resolution approving Anne Arundel County's 2022 Financial Assurance Plan for compliance with the National Pollutant Discharge Elimination Phase 1 Municipal Separate Storm Sewer System Permit.
Any additional conversation? Seeing none, Madam Secretary, please call the roll on resolution number 37-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard. Aye. Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Resolution number 3722 has been adopted.
Thank you. And thank you to the team for sticking it out to 9 o'clock. Madam Secretary, please read the title of resolution number 38-22.
Resolution number 3822, resolution authorizing the filing of an application with the Maryland Transit Administration of the Maryland Department of Transportation for an annual transportation plan grant and other funds under the Federal Transit Act for federal fiscal year 2023.
Thank you. Mr. Barron, you have the floor on this resolution.
Thank you. I have our Transportation Director, Sam Sneed, joining me, and Crystal McGill-Bellick, also from our Department of Transportation, and Miss Kelly Kenny, who's been with me for every bill. Resolution 3822 endorses the county's application to the Maryland Transit Administration for the annual transportation plan grant under the Federal Transit Act for FY23. The county anticipates receiving grants totaling just over $2.5 million as a result of this endorsement. There is a local match component of $346,000. Both the anticipated grant revenues and local match, as the auditor noted in the blue letter, have been accounted for in the budget. Mr. Sneed and his team are happy to answer any questions, but we're very excited about bringing this before you.
Thank you. Any questions from my colleagues? Just for the sake of, conveying to the public, or any highlights you're excited about with respect to what might be coming through this grant?
Sure. We've won several grants within the last few years, and then more recently in the last couple of months. Crystal McGill-Billick, I actually want to give her kudos. She co-authored the most recent application for a low-no grant, and we ended up winning that. And what this bill allows us to do is take all these funds from the federal government and expend them to improve transit in our county. So not only those funds from capital grants, but also our operating funds, which we rely on both the federal government and the state government for. Our ridership has increased between January and October, 82% with all the changes we've been making, and we're really excited about transit growing in our county. In all the different various districts, we've tried to add more transit throughout the past several years, and more specifically, the past 10 months.
Thank you very much for taking that question. All right, seeing no additional lights, we will now open the public hearing on resolution number 38-22. Madam Secretary, do we have any testimony received from members of the public?
We did not receive anything ahead of time, Madam Chair.
We also did not have anyone sign up to speak, but if there is anyone here who wishes to speak, you may come down to the table, have a seat. When it is your turn, state your name and address for the record. You will have 2 minutes. Seeing no one moving in the audience, once again, the public hearing is now closed on resolution number 38-22. Madam Secretary, please read the title of resolution number 38-22.
Resolution number 3822, resolution authorizing the filing of an application with the Maryland Transit Administration of the Maryland Department of Transportation for an annual transportation plan grant and other funds under the Federal Transit Act for federal fiscal year 2023.
Thank you. Any further discussion? Madam Secretary, please call the roll on resolution number 38-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacy.
Aye.
Ms. Pickard. Aye. Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Resolution number 3822 has been adopted.
Thank you, and thanks again to our transportation team for staying so late. Madam Secretary, please read the title of resolution number 44-22.
Resolution number 4422, resolution expressing the need for land located in Edgewater, Maryland, and owned by the Anne Arundel County Board of Education to be utilized for construction of the Woodland Beach Volunteer Fire Department.
Thank you. Mr. Pruski, this is your resolution, actually along with me and Ms. Hare, but you may have the floor first.
I'll just give a brief summary. Hopefully, since Bill 7822 passed, moving funds for the Woodland Beach Fire Department, folks would support this as well. In July, the Board of Education transferred property, or is in the process of transfer property to Anne Arundel County for the Woodland Beach Fire Department. I'm the only council member here that remembers this project, and it actually was even before me that they were talking about it. And there's been a sign up on the current property for many years, and it's not the best location because of obviously stormwater mitigation, location, traffic. It took a long time. I know there's a lot of people that tried to work this out, and the Board of Education property is the best site. Again, I'm sure the admin can give further details, but I hope the council can come together and promote this. Just for the record, some people ask why the administration would do this. Actually, when we have a transfer, according to the code, when it's Board of Ed to Anne Arundel County, it has to be introduced by a council member. That's something that I didn't even know, and we've done a lot of transfers from properties. Usually it's an excess property, but in this case, again, it's another public entity like the Board of Ed, and a council member is required to introduce it, and I'm proud to do so. Thank you.
Ms. Hare, did you want to add anything?
Councilman Pruski, he mentioned that sign. That sign has been there for so long. I'm just very excited for this resolution. Happy to co-sponsor it.
And I'll just jump in and explain why I co-sponsored it, because it already had the needed sponsorship. But I lived in London town back like 12 years ago when that sign was there, and I kind of am excited to see it come to fruition because I knew that conversation has been going on for a long time. So that's why I jumped in. All right, administration, would you like to respond?
Thanks, Madam Chair. I have our Central Services Director, Christine Anderson, with me, who really deserves, and her team really deserve most of the kudos here. Sorry, Councilman, you did the hard work of bringing the resolution forward, and we really do appreciate it. But this has been, as you mentioned, in the works for a long time. The code requires that this be a council resolution, but the administration has worked hand in glove with the council to bring this forward. We know there's an amendment coming. This was a little bit of a complicated one to get to the point where we are now, and I really do want to recognize that Christine, her team, as well as our folks in the Office of Law and our partners in the school system who really worked to make this a reality, as well as the great volunteers down at the fire station. Can't leave them out. So please pass this tonight after you amend it.
Thank you. All right. Seeing no lights from the council, we will now open the public hearing on resolution number 44-22. Madam Secretary, do we have any testimony received from members of the public?
We did not receive anything ahead of time, Madam Chair.
Thank you. We also did not have anyone sign up to testify in advance, but if there is anyone here who wishes to speak, you may come on down at this time and have a seat at the table. When it is your turn, state your name and address for the record. Remarks will be limited to 2 minutes. You may have the floor.
Here we go. Thank you very much. Joe Larson, 7771 Kidwell Drive in Hanover, Maryland. I'm the president of the Anne Arundel County Volunteer Firefighters Association, and I'd like to thank the sponsors of the bill for their effort to make this transition happen. And I remember seeing that sign quite a bit too, and remember when it first went up, and thought, you know, we're getting some good location. But the location for this new project for the firehouses can't be in a better spot. As far as off of Stephanie's Lane with access off to Solomon's Island Road, which will get the fire apparatus responders out to the community in the various places in that growing community. So, and again, I also understand that there are some projects in the idea stages for once this firehouse is built because of its location. So again, thank you very much for the support for this, and your support would be appreciated. So, thank you.
Thank you very much. Is there anyone else in the audience that would like to come down and testify? Seeing no movement in the audience, the public hearing on resolution number 44-22 is now closed. Madam Secretary, please read the title of resolution number 44-22.
Resolution number 4422, resolution expressing the need for land located in Edgewater, Maryland and owned by the Anne Arundel County Board of Education to be utilized for construction of the Woodland Beach Volunteer Fire Department.
Thank you. There is an amendment. Madam Secretary, please read amendment number 1.
Amendment number 1. This amendment corrects references to the Board of Education of Anne Arundel County and strikes the existing exhibit and replaces it with an exhibit that more accurately reflects the land transfer requested as depicted by Bay Engineering, Inc.
Thank you. Mr. Pruski, this is your amendment. You may make a brief statement if you like.
It's a technical amendment. All I ask is that you fix it and we can move on.
All right. Is there a motion to adopt?
Hare, so moved.
Is there a second?
Pruski, second.
Any discussion? Any response from the administration? I know you don't like mistakes in legislation.
Thank you. It's our long-standing policy. No, support, appreciate working with council to bring this more correct amendment forward.
All right, excellent. Seeing no further discussion, Madam Secretary, please call the roll on amendment number 1.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacey.
Aye.
Ms. Pickard. Aye. Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. The amendment to resolution number 4422 has been adopted.
And ordinarily, amended legislation would have to wait until the next meeting, but because this is a resolution, we can have the final vote this evening. Madam Secretary, please call the roll on resolution number 44-22.
Ms. Fiedler.
Aye.
Ms. Hare.
With a huge thank you to the Woodland Beach firefighters. Aye.
Ms. Lacey.
Aye.
Ms. Pickard. Aye. Mr. Volkey.
Aye.
Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Resolution number 4422 as amended has been adopted.
Thank you very much. Is there any additional business to be brought before the County Council at this time?
Madam Chair, I'm sorry to interrupt. I believe at the beginning you mentioned adding resolution 4822.
Right. I'm sorry. What number did we? Okay. Yes, you are correct. So
you just need to ask me to read resolution 4822.
Thank you. Madam Secretary, could you please read resolution number 48-22?
Resolution number 4822, resolution confirming the appointments of Anne Arundel County residents to serve on the Spending Affordability Committee.
Mr. Barron, this is an administration resolution. You may comment as you wish.
Thank you, Madam Chair. This council is very familiar with our Spending Affordability Committee and the important work they do, particularly in our budget process. We have 2 appointments to bring before you. Mr. Bradshaw is a resident of District 4. He's been very involved in nonprofits in the county, is a staunch advocate of county parks. He is being appointed for the remainder of a term which will expire December 1st, 2024. And also Mr. Matt Minahan, who is a consultant specializing in organizational management, strategic planning, and leadership development. He is also, as you have heard, a local expert on smart land use policies. He will be an excellent addition as well to the team. He is being appointed for the remainder of a term expiring December 1st, 2025. He is a resident of District 7. Please adopt this resolution.
Thank you. Seeing no lights from my colleagues, do we hold a public hearing? No. All right, very good. In that case, seeing no additional lights, Madam Secretary, please, I guess we should read it one more time though, yes? Do we need to read the resolution one more time, or we can jump into a vote?
Nope, I don't think we need to read it anymore. No public
All
hearing.
right, thank you very much. Madam Secretary, please call the roll on resolution number 48-22.
Ms. Fiedler.
Aye.
Ms. Hare.
Aye.
Ms. Lacy.
Aye.
Ms. Pickard. Aye. Mr. Volkey. Aye. Mr. Pruski.
Aye.
Ms. Rodvian.
Aye.
7 in the affirmative, none in the negative. Resolution number 4822 has been adopted.
Thank you. Now I will ask my colleagues if there is any other business to be brought before the council at this time. All right, seeing none, I will just ask my colleagues if there is any interest in holding a work session after the MDOT meeting on October 11th. That's what I figured. So seeing no excitement about that, we will not hold a work session after the MDOT meeting. This is an annual meeting that is required to be held every fall. It is a chance for MDOT to talk about priority projects in Anne Arundel County and all elected officials to ask questions. It will be right here in the council chambers on October 11th. And am I correct? It's not, yes, I see 9 a.m. All right, is there a motion to adjourn?
Motion to adjourn, Allison Pickard.
Second? All in favor? Aye. Opposed? The motion carries. This meeting is adjourned. MDOT's fall tour meeting will be held in the chambers on October 11th, 2022 at 9 a.m. This meeting is open to the public. We will not have a work session following that meeting. The final legislative meeting for this term is October 17th, 2022. Please check the council website for more information. Yom Kippur begins on the evening of October 4th. Anyone observing, please have a good fast.